Okay, you know those dramatic hospital scenes in movies with the beeping machines and those squiggly lines?
Yeah, the heart rate monitors, classic.
Exactly. But like, what are those squiggles actually telling us?
Well, that's what we're going to find out today.
Today we're diving deep into the world of electrocardiograms, ECGs for short.
Or EKGs.
Right, EKGs too.
They're basically like peeking into the heart's own electrical language.
I love that, the heart's electrical language.
It is. It's pretty amazing.
And to help us translate, so to speak, we have a podcast script
Right.
called Introduction to ECG, Understanding the Basics.
Should be a good starting point for our deep dive.
For sure. Okay, so first things first,
Mhm.
what is an ECG recording? Like, what are we actually looking at?
So an ECG is basically a visual representation of the heart's electrical activity, and it's recorded over a period of time.
So it's not just like a snapshot.
No, it's a continuous recording.
Gotcha. And why is this so important in healthcare? Like, what can we actually learn from it?
Well, by capturing these electrical signals, we can understand how well the heart is actually functioning.
So it's not just about the heart beating, it's about the efficiency of those signals.
Exactly.
Interesting. So the heart is obviously a muscle, but it's the electrical system that's really running the show.
It is, yeah, it acts like a conductor,
Oh,
orchestrating each and every heartbeat.
I'm already fascinated.
Mm.
And so this electrical system, it follows a very specific pathway.
It does, like a circuit.
Okay.
And it all starts with what we call the SA node,
SA node,
which is often referred to as the heart's natural pacemaker.
pacemaker. Interesting.
Yeah.
So what makes the SA node so special?
Well, it has this incredible ability to spontaneously generate electrical impulses.
Wow.
So think of it like, the conductor raising their baton to start the orchestra.
Got it.
That impulse then travels through the atria,
Yeah.
which are the upper chambers of the heart.
Right.
And that's actually the first electrical event that the ECG picks up.
Really? So we can actually see that happening on the recording?
We can. As the signal moves through the atria, they contract, and we get this little blip on the ECG.
A blip, huh?
Yeah, that's the P wave.
Okay, the P wave.
And that tiny wave is basically the atria squeezing
Wow.
and pushing blood down into the ventricles.
Amazing. So from there, where does that signal go?
Well, then it reaches a crucial point called the AV node,
AV node.
which sits right between the atria and the ventricles.
Okay, I feel like I've heard of the AV node before.
You probably have.
Doesn't it do something kind of special?
It does. It actually causes a slight delay in the signal.
A delay? Why would it do that?
Well, it's actually super important because it gives the ventricles enough time to fill with blood
Oh, I see.
where they contract.
It's like a strategic pause.
It is a very strategic pause.
So the heart's not just like mindlessly pumping?
No, it's a very well-coordinated dance.
Okay, so the AV node puts on the brakes for a second.
Exactly.
We see that as the PR interval on the ECG. Cool. And after that pause, where does the signal head?
So from the AV node, the signal travels down a pathway called the bundle of His.
Bundle of His, catchy.
Right. And then it splits into the right and left bundle branches.
Okay, so it branches out.
To reach both ventricles simultaneously.
Makes sense. So they contract at the same time.
Yep. And finally, the signal reaches these tiny fibers in the ventricles called the Purkinje fibers.
Purkinje fibers.
Yeah, and this final step triggers the ventricles to contract,
Oh, wow.
sending blood out to the lungs and the rest of the body.
So all of that, from that tiny spark in the SA node to the ventricles contracting,
Yeah.
that's all represented on the ECG.
It is. You see that big spike on the ECG?
Right, the big one.
That's the QRS complex,
Okay.
which represents ventricular depolarization,
Depolarization.
which basically means the ventricles are contracting.
Wow, so that's like the main event.
It is. It's the heart's power surge.
So cool.
Okay.
And then there's one last wave, right?
Yeah.
The T wave.
Yeah.
What's that one all about?
So the T wave represents ventricular repolarization,
Depolarization, okay.
which is essentially the ventricles getting ready for the next beat.
So it's like a reset button.
Exactly. Think of it like the heart taking a breath before the next cycle begins.
Okay, I think I'm starting to get this. So we've got these distinct waves, each telling a part of the heart's electrical story.
Right?
But why is it so important that we can read these signals, these squiggles? What can they actually tell us about someone's health?
Well, that's where it gets really interesting because by analyzing those waves and the intervals between them, we can actually detect irregularities that might signal heart conditions.
Oh, wow. So it's like those squiggly lines are whispering secrets about our health.
You could say that, like, for instance, let's say a P wave is missing or it looks kind of funky.
Funky.
Yeah, like abnormally shaped.
Okay, I get you.
That could mean there's a problem with the atria, like maybe they're not getting the signal right.
So like a glitch in the wiring.
Yeah, exactly. Or imagine the QRS complex is wider than it should be. Yeah, that might indicate a problem with the ventricle's conduction system,
Meaning,
meaning the electrical signal's not traveling as efficiently as it should.
so like the heart might not be beating in sync.
That's right.
Interesting.
And then you have the ST segment, which can be a big red flag.
Oh yeah, the ST segment.
Changes in the ST segment can actually point to pretty serious problems like ischemia.
Right, which is when the heart's not getting enough blood.
Exactly. Ischemia can lead to coronary artery disease or even a heart attack.
Wow, that's scary stuff.
Mhm.
So ETGs are obviously really important for diagnosis then.
Absolutely. They're crucial. Like, for example, they're used to detect arrhythmias.
Which are?
Arrhythmias are irregular heartbeats.
Okay, right.
And they can be anything from harmless to life-threatening. So an ECG can help pinpoint the type of arrhythmia.
So you can figure out the life treatment.
Exactly.
That makes sense.
And another example is diagnosing heart attacks.
Okay.
ECGs can show signs of damage to the heart muscle.
From the heart attack.
Yeah, from a blockage in the blood flow. So rapid diagnosis with an ECG is crucial.
To get patients the treatment they need quickly.
Exactly.
It sounds like ECGs are like a cardiologist's best friend.
Pretty much.
But how do they actually go about reading and interpreting all those squiggles in practice?
Well, it's a systematic approach focusing on three main things: rhythm, rate, and morphology.
Rhythm, rate, and morphology. Okay, let's break those down.
Yeah.
What's rhythm all about?
Rhythm refers to the regularity of the heartbeat.
Okay.
So are the P waves and the QRS complexes appearing at consistent intervals,
Right.
or are they irregular?
So basically, is the heart beating to a steady drum beat?
Exactly. And the rate is simply how fast the heart is beating.
Beats per minute.
Yep, beats per minute. And we can figure that out by counting the QRS complexes over a certain time.
Okay, that makes sense.
So you got the heart's rhythm and its pace.
Right.
Now, what about morphology?
Yeah, what is morphology exactly?
Morphology refers to the shape and size of the waves. Are they normal, or are there any, unusual patterns or variations?
So it's kind of like analyzing handwriting.
It is.
You're looking for anything that's out of place.
Exactly. Any deviation from the norm could signal something's up.
It's funny. I was just reading about how researchers are using artificial intelligence to analyze ECGs now.
Oh, yeah.
Yeah, to predict things like the risk of heart failure.
It's amazing.
I know. It's crazy how technology is changing everything.
AI and machine learning are revolutionizing cardiology for sure.
It's like having this super-powered second set of eyes,
They can pick up on subtle patterns that humans might miss.
leading to faster and more accurate diagnoses.
Exactly.
This is making me realize just how powerful the ECG really is.
It's a remarkable invention.
For sure. But we've got to take a break for now.
All right.
We'll be back soon to continue our deep dive into the fascinating world of ECGs, so stay tuned.
We're back and ready to wrap up our deep dive into ECGs.
I'm ready. I feel like we left off on a pretty big question before the break.
We did. We were talking about how the electrical activity we see on an ECG actually translates into the heart, like physically pumping.
Right, like what makes the heart muscles actually contract and push the blood.
It's a really cool process. Basically, the electrical signals are like the commands telling those heart muscles when to contract.
Okay, so the electrical signal is the trigger,
Mm-hmm.
and the muscles are the engine.
I like that. Yeah, perfect analogy. So when that signal reaches the muscle cells, it sets off this chain reaction that leads to those cells shortening, and that's what causes the contractions.
So it's like a domino effect. The signal kicks everything off.
Exactly. And the strength and timing of those contractions are what create the pressure to move the blood through the body.
This makes me think, are there other things besides those electrical signals that can affect how the heart beats?
Oh, for sure.
Like what?
Well, your heart's always adapting to your body's needs, right?
Right.
So things like hormones, like adrenaline, can speed up your heart rate.
Right, when you get scared or excited.
Exactly. And then relaxation techniques can actually slow it down.
Interesting.
Even your breathing can have a subtle effect on your heart rhythm.
Wow, I never thought about that. So the heart's not just this isolated organ.
Yep.
It's constantly talking to the rest of the body.
All the time. It's a dynamic system for sure.
Well, this has been an amazing deep dive. I've learned so much.
Me too. It's always fun to revisit the basics.
I know, right? I feel like I can actually understand those squiggly lines now.
That's the goal.
And it makes me appreciate just how complex and incredible the heart really is.
Absolutely.
Like we've learned a secret code.
We have the language of the heart. And remember, even though we've only covered the basics,
Right.
understanding those fundamentals can make a real difference.
For sure, whether you're a doctor or a nurse or just someone who's interested in how their body works,
Yes.
knowing about ECGs is pretty powerful.
It is. It lets you connect those squiggly lines to what's actually happening inside,
To that incredible symphony happening inside every one of us.
keeping us alive and thriving, beat after beat.
On that note, I think it's time to wrap up this deep dive.
Sounds good.
Thanks for joining me on this journey into the world of ECGs.
Thanks for having me.
And to all our listeners, keep those hearts beating strong and those minds curious. Until next time. All right, welcome to another deep dive. We're going to be like cardiologists today,
Oh, wow.
deciphering the secrets of the 4-lead ECG.
Okay.
You know, like EKGs,
Sure.
we see them in the hospital all the time,
Mm.
and
Yeah.
we're going to be able to read them.
Awesome.
So it's like we're going to get X-ray vision, but for the heart,
I like it.
for its electrical activity.
Very cool.
So by the end of this deep dive, we're going to really have a solid understanding of how these leads
Okay.
work together to give us like a picture of our heart rhythm.
Awesome.
And our source material today is actually a podcast script
Oh, cool.
for healthcare students on this topic.
Nice.
So it's pretty in-depth.
That's pretty meta, a podcast script for a podcast.
I know, right?
That's awesome.
So let's start with the basics.
Okay.
Why 4 leads? Why not just one?
Well, it's kind of like, if you were to describe a sculpture
Okay.
and you could only see it from one point of view,
Right.
you'd miss so much of like the detail and like,
The nuance.
the nuance and how intricate it is.
Right.
So the same with the heart, it's electrical activity.
Yeah.
It's 3-dimensional and it's moving, right?
Right.
So each lead is like a different camera angle.
Oh, okay.
And so it's giving you a different perspective of that same electrical activity.
So each lead is actually measuring like from a different point.
Exactly. So each lead is measuring the electrical potential difference between 2 points. So think about it kind of like measuring the voltage between 2 points in a circuit.
Okay.
And that difference in electrical potential
Okay.
is what generates the waveforms that we see on the ECG.
Gotcha. Okay, so lead 2, I hear, is like kind of a big deal.
It is. It's definitely like the VIP
That-
of the 4-lead ECG. It's the one that's most commonly used
Okay.
for monitoring heart rhythms. And that's because it often provides the clearest view
Okay.
of the electrical signals as they travel through the heart.
So why lead 2? What's so special about it?
Well, it basically has to do with the fact that it's aligned closely with the heart's natural electrical axis.
The electrical axis.
Yeah, so basically, So the heart generates these electrical impulses, right?
Right.
And they spread through the muscle, and that's what causes it to contract and pump blood.
Right.
And that electrical activity has a general direction. And lead 2 is positioned in a way that's kind of like perfectly aligned
Oh.
to capture that activity. And so that's why it often gives us the best view of things like the P wave, the QRS complex, the T wave, all those key components of a heartbeat.
So it's like lead 2 is perfectly placed to pick up like the heart's electrical symphony.
That's a great way to put it. Yeah. And so because lead 2 gives us such a clear picture, it's like our go-to for assessing things like heart rate,
Okay.
rhythm, regularity,
Okay.
if there's any abnormal beats,
Okay. Gotcha. So lead 2 is like our foundation.
pretty much.
But then we have these other leads, right? What are they giving us?
Yeah. What unique info?
They each kind of add another layer to our understanding.
Okay.
So for example, lead 1,
Uh-huh.
lead arm measures the electrical potential difference
Okay.
between the right arm and the left arm.
So it's giving us like a horizontal
Exactly.
kind of picture.
Yeah, it's like looking at the heart from the side,
Okay.
whereas lead 2 is kind of looking at it from the top down.
Gotcha. Okay. And then lead 3 is left arm, left leg.
You got it. Yeah, so lead tip and lead lug kind of work together to give us a view of the electrical activity moving from the top to the bottom of the heart.
Okay.
It's just slightly different angles
Yeah. Okay.
on that same journey.
Gotcha. So it's like each lead is like a piece of the puzzle.
Yeah,
Right.
exactly.
And then we get the full picture.
Uh-huh.
Now we have these augmented leads, AVR, AVL, AVF.
Yeah.
They sound a little more
Complex.
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 They do?
Yes.
but they're just as important
Go.
in kind of completing our ECG puzzle.
Okay.
So let's start with AVR. Now, this one's unique because it's considered a unipolar lead,
Okay.
which means that it measures the electrical potential at one specific point
Okay.
compared to like a combination of the other leads.
Okay, so instead of between 2 points, it's like from a single point?
Exactly, yeah. So now AVR often shows like a downward deflection.
Downwards, does that mean something's wrong?
No. It's totally normal for AVR. And again, remember, it's all about perspective.
Okay.
So if you think about lead-2 as looking at the front of the heart, AVR is looking at the back.
So the opposite.
Yeah, like a mirror image.
Okay.
And so it might look different, but it's still crucial for understanding the overall pattern.
Okay. All right, so AVR is our mirror image.
Exactly.
And AVL and AVF, what are they?
Yeah, so they're also unipolar leads.
Okay.
And they give us very specific views of the heart.
Okay.
So, for example, AVL is positioned to look at the lateral wall of the heart.
Okay.
Particularly the left ventricle, which is that main pumping chamber.
So it's like zooming in on a particular area.
Exactly. So it's really useful for detecting any abnormalities in that region. And then we have AVF, which looks at the heart from an inferior perspective.
Okay.
So kind of like looking up at it from the bottom.
Okay, so like below.
Exactly.
Yeah.
Yeah, and so AVF is particularly helpful for identifying any issues with the bottom portion of the heart, which is really crucial during a heart attack.
Oh, wow.
In that area, because it can tell us if those lower portions of the heart are receiving those electrical signals.
Okay.
They need to function properly.
So we have lead 2 showing us the whole picture.
Yeah.
Lead I giving us horizontal.
Uh-huh.
Lead 3 another angle.
Mm-hmm.
AVR, mirror image.
Yes.
AVL, lateral.
Yep.
AVF from below.
Mm-hmm.
Wow. They each have a very specific...
It's incredible, right?
Yeah.
They all have their own purpose.
It's amazing how they all come together to give us that electrical activity of the heart.
It really is. It's like they each are a specialist.
Right.
And then they come together as a team of experts to reveal the heart's secrets.
I feel like I can almost read an ECG myself now.
Almost.
But I know we just scratched the surface.
Yeah, there's a lot more to learn.
We've got to talk about how they're all used together to really analyze the heart rhythms.
Absolutely, yeah. The real magic happens when we start comparing and contrasting all 6 leads. That's where the real diagnostic power lies.
This is great. So we've laid the foundation.
Yes.
And I'm ready to dive deeper into the world of the 4-lead ECG.
I'm excited.
Let's do it.
Let's do it.
So stay tuned.
Welcome back to the deep dive. So we've laid the groundwork understanding each of the 4 leads on the ECG acts like a specialized camera, giving us different views of the heart's electrical activity.
Right.
But now...
we've got to figure out how to put all those views together.
Exactly.
Okay, I'm ready to put on my detective hat and start analyzing those squiggly lines like a pro. Yeah. Where do we even begin?
Well, the first step is to understand that each lead gives us more than just a snapshot. It's not just about whether a wave is present or absent, but it's also about its shape, its size, and its duration. These subtle details can reveal a lot about the underlying heart rhythm.
So it's like we're looking for clues within the clues.
Precisely. For example, let's look at the P wave. In lead-2, we expect to see a nice, smooth P wave representing the electrical activity spreading across the atria, the heart's upper chambers. But if that P wave is unusually tall and peaked, it could indicate that the right atrium is enlarged, possibly due to a condition like pulmonary hypertension.
So the shape of the wave can actually tell us about the physical structure of the heart.
Exactly.
It's like reading the heart's fingerprint.
That's a great analogy. Now let's move on to the QRS complex, which represents the spread of electrical activity through the ventricles, the heart's main pumping chambers. As we talked about earlier, a wide QRS complex might indicate a conduction delay.
Right.
Meaning the electrical signals aren't traveling through the heart as efficiently as they should.
It's like a traffic jam.
Exactly.
In the heart's electrical pathways.
Exactly. But the shape of that QRS complex can give us even more specific information. For example, if the QRS complex in certain leads has a notched or M-shaped appearance, it could suggest a bundle branch block.
A bundle branch block? What is that?
It's a condition where one of the specialized pathways that conduct electrical signals through the ventricles is partially or completely blocked. This blockage disrupts the normal flow of electricity, causing that distinctive M shape in the QRS complex.
So we're looking for patterns and deviations from the norm, just like a detective analyzing fingerprints or handwriting samples.
Precisely. Now, to get the most comprehensive view of the heart's electrical activity over time,
Okay.
we use what's called a rhythm strip.
A rhythm strip. What's that? Is that like a highlight reel of the heart's electrical activity?
It's actually a continuous recording of the ECG from one specific lead, usually lead 2 over an extended period, typically about 10 seconds or so. This gives us a dynamic view of how the heart is beating over time. It's like watching a movie of the heart's electrical activity, rather than just looking at a single snapshot.
So instead of just seeing one heartbeat, we're seeing a series of heartbeats, which
Exactly.
allows us to track the rhythm and identify any irregularities.
Exactly. By analyzing the rhythm strip, healthcare professionals can determine the heart rate, assess the regularity of the heartbeat, and look for any extra or missing beats. They can also see how the different waves and complexes change over time, which can be crucial for diagnosing certain heart conditions.
I can just imagine doctors huddled around an ECG machine, analyzing every blip and curve, trying to solve the mystery of the heart's rhythm.
It's certainly an exciting field,
Yeah.
and while it might not always be as dramatic as a TV show,
Sure.
the 4-lead ECG plays a vital role in diagnosing and monitoring a wide range of heart conditions.
It's amazing to think that those 6 seemingly simple leads, each with its unique perspective, can unlock so much information about the heart.
It's a testament to the power of observation and deduction, and the incredible ingenuity of those who pioneered the field of electrocardiography.
I'm so glad we're getting this deep dive into the 4-lead ECG, because it's clearly much more than just squiggly lines on a screen.
Absolutely. It's a language, a story waiting to be told. And with a little knowledge and practice, anyone can begin to understand its secrets.
Well, we've explored the leads. We've talked about analyzing the shape and size of those all-important waves and complexes.
Right.
And we've even touched on the power of the rhythm strip.
We have.
What else is there to uncover in the world of the 4-lead ECG?
Now that we understand the language, let's talk about what it's telling us. We'll move on to the practical implications of all this knowledge, the so what of the 4-lead ECG.
Okay, I'm ready to see how all of this translates into real-world scenarios. I can't wait to find out what those squiggly lines are really trying to tell us. Okay, welcome back to the deep dive. We spent the last 2 parts really getting to know the 4-lead ECG,
We have.
from its individual leads to the secrets hidden in those waves and complexes.
Yeah.
But now it's time to see how this all translates into the real world,
It is. It's time for the so what.
right? We've learned the language, but what's the story that it's telling?
Well, the 4-lead ECG is a really powerful tool that allows healthcare providers to make critical decisions about patient care.
So it's not just about cool patterns.
No.
It's actually about helping people.
Absolutely. One of the most important applications of the 4-lead ECG is in emergency situations. Imagine somebody comes into the hospital complaining of chest pain.
Right.
The 4-lead ECG can quickly determine if they're having a heart attack
Oh, wow.
and guide immediate treatment decisions.
It's like a first line of defense,
Exactly.
helping get people the right care.
Yeah, because in those critical moments, time is of the essence.
Right.
And the 4-lead ECG provides this vital information
Okay.
within minutes. And so medical teams can make really informed decisions that can be truly life-saving.
So it's not just about squiggly lines. It's about saving lives.
It really is, but it's useful beyond just those emergency situations.
Okay.
The 4-lead ECG is also valuable for routine monitoring
Right.
in lots of healthcare settings, so it's used during surgery
Okay.
to monitor the heart rhythm.
Makes sense.
Under anesthesia, it's used in intensive care units
Right.
where patients need continuous cardiac monitoring.
So even when things seem stable, it's like it's working in the background,
Exactly.
just making sure everything is okay.
And that continuous monitoring can be crucial for detecting subtle changes in heart rhythm
Right.
that might otherwise go unnoticed.
So it can prevent problems.
Exactly.
Yeah.
For example, imagine a patient recovering from surgery
Right.
and their vital signs might seem normal,
Right.
but their 4-lead ECG
Right.
could reveal a subtle arrhythmia that requires attention.
Wow.
And so by catching these irregularities early, healthcare providers can intervene and potentially prevent more serious complications.
It's amazing how these 6 little leads can give us so much.
It really is. It is a testament to the power of electrocardiography.
Yeah.
But, the 4-lead ECG is incredibly useful, but it's important to remember that it's just one piece of the puzzle.
Right.
It's like getting a basic snapshot of the heart's electrical activity.
So what are some of the other tools that are out there?
Oh, there are lots of really amazing advancements in cardiac diagnostics.
Okay.
So you have a 12-lead ECG, which provides even more perspectives
Mm.
on the heart's electrical activity, so a much more comprehensive view.
Okay.
And then you have imaging techniques
Right.
like echocardiograms,
Yeah.
which use sound waves to create real-time images
Oh, wow.
of the heart's structure and
So we
function.
could actually see it beating.
Yes, exactly. You can see the valves opening and closing.
That's incredible.
It is really cool. And, that's just a couple examples.
Right.
The field of cardiology is constantly evolving with new and innovative ways to understand and care for this vital organ.
I agree. This deep dive has been an amazing journey.
It has.
We've gone from, the very basics of electrical signals
Yeah.
to understanding how the 4-lead ECG is used to make life-saving decisions
Every day.
every single day. I feel like I've learned so much
You too?
about the human heart.
Yeah.
So to all of our listeners,
Yes.
as we wrap up this deep dive into the 4-lead ECG,
Mhm.
remember, never stop asking questions.
Yeah, keep learning.
Keep learning, never stop exploring,
Right.
and never underestimate the power of knowledge.
It's incredible.
It really is. Thanks for joining us on the Deep Dive. Welcome back, everybody, to another Deep Dive. This time we're going deep into the world of those crazy heart rhythms, atrial flutter and ventricular fibrillation. You guys already know the basics. You know about arrhythmias. You know how the heart works.
Right.
But we're going to go a little deeper today and explore the nitty-gritty of these two conditions.
That's right. And they can be pretty serious, so it's good to know a little bit more about them,
Exactly.
even though they sound scary.
Yeah.
Breaking them down can actually make them pretty fascinating.
Right.
Pretty interesting.
So let's start with atrial flutter.
Okay.
I feel like that one often gets confused with atrial fibrillation.
Yeah. A fib and a flutter.
Right.
Yeah.
But I'm guessing there's some important distinctions.
Oh, yeah. Absolutely. So both of them, they both involve the upper chambers of the heart,
Right.
the atria,
Atria.
beating irregularly. But atrial flutter has a really unique signature on an ECG,
Okay.
a very distinctive sawtooth pattern.
Sawtooth. Okay, now you've got me interested. What does
Yeah.
that even look like?
So imagine you're looking at an ECG,
Okay.
and instead of those nice, smooth, rounded P waves you'd normally see, you get these rapid-fire, jagged spikes, almost like the teeth of a saw.
Interesting.
These are the P waves.
Okay.
But they're happening so fast, between 250 and 350 beats per minute,
Oh, well.
that they lose their smooth shape.
Oh, so the atria are like trying to do their job. They're just going way too fast.
Exactly. And it's all thanks to this single rogue electrical signal.
Oh, no.
An ectopic focus usually found in the right atrium.
Okay.
This little troublemaker sets off this rapid-fire loop of electrical activity, causing the atria to contract over and over again.
And that's what creates that sawtooth pattern.
That's the sawtooth pattern.
Gotcha. But if the atria are going that crazy, wouldn't the ventricles, the heart's main pumping chambers, wouldn't they have to keep up?
That's where the AV node comes in.
Okay.
So it's the electrical gateway between the atria and the ventricles. Think of it as a bouncer at a very exclusive club.
Okay.
It lets some of those rapid-fire impulses through to the ventricles, but not all of them.
Okay, so the ventricles aren't contracting as frantically as the atria, but they're still getting bombarded with more signals than they should.
Right.
What does that mean for someone with atrial flutter? What are the real-world implications of this electrical frenzy?
So while it's not as immediately life-threatening as some other arrhythmias, atrial flutter can still have some serious consequences.
Okay.
Because when the atria are fluttering that rapidly, they don't have enough time to properly fill with blood.
Okay.
It's like trying to fill a bucket with a fire hose.
Yeah.
The force is there, but the bucket never really gets full.
Right.
This can lead to a decreased cardiac output,
Okay.
meaning the heart isn't pumping out as much blood as it should.
So I could see where that would start to cause some problems. What kind of problems?
Well, decreased cardiac output can lead to fatigue and shortness of breath. But one of the biggest concerns with atrial flutter is the increased risk of stroke.
Ah, so that chaotic blood flow in the atria could lead to clots forming, which could then travel to the brain. That's a scary thought.
Yeah, that's a big concern. And that's why early detection and treatment of atrial flutter are so crucial.
Yeah.
We want to control that heart rate, prevent those clots from forming, and if possible, get those atria back to their normal rhythm.
So atrial flutter is definitely not something to take lightly. It's kind of like having a mischievous gremlin messing with your heart's electrical system.
That's a great analogy. But now let's shift gears to a scenario where the heart's electrical system faces an even bigger challenge.
Okay.
Ventricular fibrillation.
Okay.
This is a condition where things can go from seemingly fine to life-threatening in an instant.
Ooh, I can feel the intensity building already. I know ventricular fibrillation, or VFib as I've heard it called, is incredibly serious. But what makes it so different from atrial flutter?
So in atrial flutter, the atria are misbehaving, but there's still some semblance of order. The ventricles are still contracting, albeit a bit erratically. But in ventricular fibrillation, it's like the conductor of the heart's orchestra has suddenly vanished.
Oh.
The ventricles, instead of contracting in a coordinated rhythm, are just quivering chaotically.
Oh, so instead of that coordinated pumping action that pushes blood out to the body, it's just this random, ineffective twitching.
Exactly. And that's why ventricular fibrillation is so dangerous. The heart in this state is simply unable to pump blood effectively.
Right.
No blood flow means no oxygen getting to the vital organs, including the brain.
This sounds absolutely terrifying. And I imagine it requires immediate action.
You're absolutely right. Ventricular fibrillation is a full-blown cardiac emergency.
Right.
Every second counts. Without prompt intervention, it leads to cardiac arrest and death.
Wow, this
Wow.
is serious stuff. We talked about that rogue signal causing the atria to flutter, but what throws the ventricles into this chaotic state?
So there are a few different things that can trigger it.
Okay.
One of the most common is a heart attack. When a coronary artery becomes blocked, cutting off blood supply to a portion of the heart muscle, it can create this wave of electrical instability that can spiral into ventricular fibrillation.
So it's like that damaged heart muscle creates a short circuit in the heart's electrical system.
Right. Exactly.
Are there any other culprits besides a heart attack?
Yeah. Electrolyte imbalance is severe trauma. Even certain medications or drug toxicities can disrupt the heart's electrical stability, potentially triggering ventricular fibrillation.
So it's like this delicate balance, and any number of things can throw it off. But while atrial flutter seems somewhat manageable, ventricular fibrillation sounds like a completely different beast.
It is.
Yeah.
Atrial flutter we can often manage with medications and lifestyle changes, but ventricular fibrillation requires a much more immediate and aggressive approach.
This is a lot to take in. We've gone from the rapid-fire sawtooth pattern of atrial flutter to the chaotic electrical storm of ventricular fibrillation. It's clear that understanding the differences between these two conditions is crucial.
Absolutely. And recognizing those differences, especially when looking at an ECG, can be vital in determining the right course of action.
Well, I'm definitely feeling the weight of that statement.
Yeah.
But before we dive into the specifics of treatment, let's take a moment to recap what we've learned so far. Atrial flutter, with its telltale sawtooth pattern, is serious but often manageable. Ventricular fibrillation, on the other hand, is a true cardiac emergency requiring immediate intervention.
Exactly. And while they might look different on an ECG, both can have serious consequences if not diagnosed and treated promptly.
It sounds like understanding those ECG patterns is key, especially in a high-pressure situation. But we'll save that deeper dive into treatment approaches for our next episode. Join us then as we explore the tools and techniques used to manage these complex heart rhythms and help patients regain their heart's natural rhythm.
Welcome back to our deep dive into those fascinating but sometimes freaky heart rhythms.
It's time to shift gears from diagnosis to action. We've explored atrial flutter and ventricular fibrillation. Now let's talk about how we tackle these conditions and get that heart back on track.
Absolutely. And like we talked about before, the approaches are pretty different depending on whether we're dealing with that gremlin in the atria or a full-blown electrical storm in the ventricles.
Right. Okay, so let's start with atrial flutter.
Okay.
We know it's often less immediately life-threatening,
Right.
but still requires careful management.
Right.
So where do we typically begin?
Well, medications are often that first line of defense.
Okay.
We're aiming to slow down that rapid heart rate, prevent those pesky blood clots from forming, and ideally nudge those atria back into a normal sinus rhythm.
So it's like a multi-pronged approach.
Right.
What kind of medications are we using for this cardiac balancing act?
So two common groups are beta blockers and calcium channel blockers.
Okay.
They work in slightly different ways, but essentially act as those bouncers at the AV node,
Uh-huh.
calming things down and preventing too many of those rapid-fire atrial impulses from reaching the ventricles.
So they're like traffic controllers,
Yeah,
helping to regulate the flow of electrical signals.
exactly.
But what if medications alone aren't enough?
Well, in those cases, we might consider a procedure called cardioversion.
Oh, that's the one where we use a controlled electrical shock to try and reset the heart's rhythm, right?
Right.
It sounds a bit like defibrillation, but less dramatic.
That's a good way to put it.
Okay.
Yeah, it's like a gentle but firm electrical nudge
Uh-huh.
aimed at coaxing the heart back into its normal rhythm.
Okay.
And unlike defibrillation, which we'll discuss later, cardioversion is synchronized with the heart's electrical activity.
So it's more like a well-timed tap on the shoulder than a full-on jolt to the system.
Exactly.
And it's effective for atrial flutter.
Often, yes. For many patients, cardioversion can successfully restore normal sinus rhythm, especially if the atrial flutter is relatively new or hasn't been present for a long time.
Okay. But I imagine there are cases where even medications and cardioversion aren't enough to fully tame those misbehaving atria.
You're right. Sometimes we need to take a more targeted approach, and that's where catheter ablation comes in.
Right. We touched on that briefly earlier. It involves threading a thin catheter through a vein onto the heart right.
Exactly. And once we pinpoint that exact location of that troublesome ectopic focus that's driving the atrial flutter, we use radiofrequency energy to create a tiny scar.
So it's like a strategic roadblock, preventing those rogue electrical signals from causing further mayhem.
That's the idea. And it can be incredibly effective in preventing future episodes of atrial flutter.
It's amazing how we can pinpoint such a tiny area in the heart and make such a precise intervention.
But now let's shift our focus to ventricular fibrillation.
Okay.
And I know this is a whole different ballgame, where time is absolutely of the essence.
Absolutely. With VFib, there's no time for medications or elaborate procedures. The heart needs a powerful intervention to disrupt that chaotic electrical storm and give it a chance to reboot.
And that's where defibrillation comes in, right? That high-energy shock we've all seen in movies and TV shows.
Hmm.
Exactly. Defibrillation is like hitting the heart's reset button.
Yeah.
A powerful jolt aimed at stopping that chaotic quivering and allowing the heart's natural pacemaker to regain control.
It sounds intense, but clearly life-saving. And I know the defibrillator technology has become much more accessible in recent years.
Absolutely. We now have AEDs, or automated external defibrillators. They're designed to be used by anyone, even with minimal training.
Right.
They're found in public places, workplaces, even schools.
It's incredible to think that something as simple as a small device can have such a profound impact on someone's life.
It really can. Knowing how to use an AED can empower anyone to potentially save a life during those critical first few minutes of cardiac arrest.
Absolutely. So speed is key in ventricular fibrillation. But what happens after that initial shock? What are the next steps in the journey back to a healthy heart rhythm?
So ideally, that single shock will be enough to restore a normal rhythm.
Okay.
But sometimes further shocks or medications are needed to stabilize the patient.
And I imagine this all happens in a hospital setting.
Yes, once emergency medical services arrive, they'll take over,
Okay.
transport the patient to the hospital, and continue to monitor and manage their care.
So the immediate response is about getting that heartbeat effectively again. But what about the long-term management of ventricular fibrillation? How do we prevent it from happening again?
That's where the detective work comes in.
Okay.
After the initial crisis has passed, it's crucial to figure out what triggered the ventricular fibrillation in the first place.
So we're looking for clues like a cardiac Sherlock Holmes.
Exactly. Was it a heart attack? An electrolyte imbalance? A drug interaction?
Okay.
Once we identify that underlying cause, we can tailor the treatment accordingly.
So that might involve medications, lifestyle changes, or even more invasive procedures like angioplasty or bypass surgery.
Precisely. The goal is to not only manage the immediate crisis, but to address the root cause and reduce the risk of future episodes.
This has been a lot to absorb. We've gone from the gentler approaches of medication and cardioversion for atrial flutter to the more dramatic intervention of defibrillation for ventricular fibrillation. But it's clear that both conditions require prompt attention and a carefully tailored approach.
You're right. And while our understanding of these conditions and the tools we have to manage them are constantly evolving, one thing remains constant. Recognizing the warning signs and seeking medical attention promptly can make all the difference.
Well said. But before we wrap up, I'm curious about what's on the horizon in the world of cardiac care. What advancements have you excited about?
Oh, that's a great question. And it leads us perfectly into our next segment, where we'll explore the cutting edge of arrhythmia treatment. Think new medications, innovative ablation techniques, and even the role of artificial intelligence in predicting and managing these conditions.
Okay, now you've really piqued my curiosity. Let's dive into the future of cardiac care. So we've covered the tried and true methods
Yeah.
for managing these conditions. But I'm really eager to hear about the innovations that are kind of changing the landscape of cardiac care.
Yeah.
What's got you particularly excited these days?
Well, one area that's really taking off is the development of new antiarrhythmic medications.
Oh, so we're going beyond those beta blockers and calcium channel blockers.
Exactly. Researchers are exploring medications that target very specific ion channels in the heart.
Okay.
These channels are like tiny little gateways that control the flow of electrical signals. And by targeting them very precisely, we might be able to control arrhythmias with fewer side effects and greater effectiveness.
So it's like we're getting more surgical with our approach,
Right.
aiming for a more precise impact.
Exactly.
Are there any other promising avenues in medication development?
Yeah, there's a lot of buzz around medications that could potentially prevent atrial fibrillation from developing in the first place.
Whoa.
Imagine being able to intervene before those troublesome atrial flutters even begin.
That would be a game changer for so many people.
It would.
But what about the folks that already have atrial fibrillation? Are there any advancements that could improve their treatment options?
Well, catheter ablation is another area that's rapidly evolving.
Right, we talked about that earlier as a way to kind of create those strategic roadblocks
Exactly.
in the heart's electrical pathways. So what's new and exciting on that front?
Well, the technology is becoming incredibly sophisticated. We now have catheters that can create 3D maps of the heart's electrical activity,
Wow.
giving us a much more detailed and nuanced picture of what the arrhythmia is doing.
So it's like having a GPS for the heart,
It is.
allowing us to navigate those electrical pathways with incredible precision.
That's a great way to put it. And with this advanced mapping, we can deliver the ablation energy with pinpoint accuracy, minimizing damage to surrounding tissue and increasing the chances of successfully eliminating the arrhythmia.
It's really amazing to think how far we've come from those early days of cardiac care. What other innovations are shaping the future of arrhythmia management?
This might sound like something out of science fiction,
Okay.
but artificial intelligence is starting to play a role in cardiology.
AI for the heart.
Yes.
I'm intrigued. Tell me more.
So researchers are developing algorithms that can analyze ECGs and other patient data to identify individuals who are at risk of developing atrial fibrillation or ventricular fibrillation. Imagine being able to predict who's likely to have these conditions before they even experience symptoms.
Wow. So we're talking about early intervention and possibly even prevention.
Exactly. That's the potential of AI in cardiology. It could revolutionize the way we approach heart health, shifting from reactive care to proactive prevention.
It's incredible how technology is transforming every aspect of medicine. Are there any other technological advancements you're particularly excited about?
Wearable technology is another area to watch.
Okay.
You know those smartwatches and fitness trackers that many people wear?
Yeah.
Those are becoming increasingly sophisticated in their ability to monitor heart rhythm.
So they're not just for counting steps anymore. They're evolving into like powerful tools for managing heart health.
Exactly. Some of these devices can now detect irregular heartbeats and alert both the wearer and their physician, allowing for early intervention and potentially preventing serious complications.
This deep dive has been truly eye-opening.
It has.
We've explored the intricate workings of the heart's electrical system, the challenges posed by atrial flutter and ventricular fibrillation, and the amazing advancements that are transforming cardiac care. I'm leaving this conversation with a sense of awe and optimism for the future.
Yeah, me too. It's an exciting time to be in cardiology. The field is constantly evolving, and we're making incredible strides in our ability to understand, diagnose, and treat these conditions.
Well, thank you so much for taking us on this journey through the world of, complex heart rhythms.
My pleasure.
It's been fascinating and incredibly insightful.
Remember, knowledge is power. The more we understand about these conditions, the better equipped we are to manage them effectively and advocate for our own heart health.
That's a message we can all take to heart. Until next time, keep those heartbeats strong and stay curious about the science that's shaping the future of medicine.
Absolutely. And if something from this deep dive sparks a question or sends you down a research rabbit hole,
Huh?
don't hesitate to explore. That's what makes this journey so rewarding.
Well, thanks for joining us. It's been a privilege guiding you through this deep dive into the fascinating and ever-evolving world of atrial flutter and ventricular fibrillation.
Until next time, stay curious and keep learning.
Take care, everyone.
All right, everybody, welcome back for another deep dive. You guys sent in some really cool stuff on advanced 12-lead ECG interpretation. I even saw a whole podcast episode transcript on this one, so we've got our work cut out for us today. But before we get totally lost in all those squiggly lines, can you maybe just give me a quick refresher on what actually makes the 12-lead ECG so much more powerful than a basic, like, 4-lead?
So a 4-lead ECG is like trying to understand all the traffic patterns in a big city, but only watching one intersection.
Yeah.
Maybe get a little glimpse, but
Yeah.
a 12-lead, it's like having cameras all over the city. It gives you that much more complete picture of all the electrical activity in the heart from all those different angles.
That is a fantastic analogy. Okay, so
Mhm.
with all those 12 leads, then we're not just seeing the heart beating, or we're actually seeing the electrical signals moving through all the different parts of the heart, right?
Exactly, and that's why the placement of each one of those electrodes is so important. So you have 6 leads that go directly across the chest. These are called the precordial leads V1 through V6. And then we have 4 more leads that are placed on the limbs. And it's that whole setup that lets us look at the electrical activity from literally all sides.
Okay, so placement is key. Now, what I'm really curious about is how this all translates to diagnosing actual heart conditions. You know, the material that you sent mentioned myocardial infarctions, which I know is the medical term for a heart attack. So how can a 12 lead help with that?
Well, it all comes down to recognizing the different patterns in the ECG. For example, ST elevation in leads that are right next to each other, especially when it's accompanied by what we call reciprocal changes in other leads, is a really strong indicator of a myocardial infarction. But we always want to make sure to correlate those ECG findings with the patient's symptoms and their full medical history, of course.
Okay, so it's not just about seeing ST elevation, it's about the whole pattern and the bigger picture. This is really cool. The 12 lead can even help to pinpoint the location of the damage, right? Like a map leading doctors to the problem.
Exactly. For example, we see ST elevation in leads 2, 3, 3 in AVF. That often suggests that the infarction is in the inferior wall of the heart, which is usually supplied by the right coronary artery.
Okay, so the location of those ST elevations can help narrow down what's going on. Now, I've also heard about something called bundle branch blocks. What are those and how do they show up on a 12 lead ECG?
Bundle branch blots happen when there's a disruption in the conduction system of the heart. You can think about the electrical signal as a message that tells the heart to contract. If there's a block in one of the branches, that message either gets delayed or distorted.
So, like a roadblock in the heart's wiring? That sounds pretty serious.
It can be. And the 12-lead ECG is really important in being able to identify the type and the location of the block. For example, a left bundle branch block often presents with a wide QRS complex that's usually greater than 0.12 seconds. And it also has some characteristic STT wave changes as well.
So there are specific visual cues that point to different types of bundle branch blocks. I guess this is where the advanced interpretation comes in, right? Being able to recognize those more subtle differences.
Precisely. It's not just about seeing the squiggle on the paper. It's about understanding what that squiggle actually means in the context of the patient. It's like putting together all the pieces of a puzzle to get the complete picture.
All right, so we've covered heart attacks and bundle branch blocks. What other conditions does the 12 lead help us diagnose? The material that you sent over also mentioned arrhythmias.
Yeah, so ventricular tachycardia, or VT, is a particularly dangerous arrhythmia that makes the heart's ventricles beat way too fast. On a 12 lead, you'll see wide, bizarre-looking QRS complexes without any preceding P waves, and it's often at a rate of over 100 beats per minute.
Whoa, that sounds pretty dramatic. I'm guessing in this case, speed is key.
Absolutely. VT can really quickly compromise cardiac output and even lead to cardiac arrest. So recognizing it on the ECG is super important for getting them the right treatment as fast as possible.
VT is a red flag. What about less urgent arrhythmias? Does the 12 lead help with those too?
Definitely, it can help identify a whole range of arrhythmias, from atrial fibrillation, which makes the atria kind of quiver chaotically, all the way to bradycardia, which is a slower than normal heart rate. Each arrhythmia has its own ECG pattern, which lets us make a really specific diagnosis.
So by analyzing the shape, the rhythm, the timing of all those electrical signals, doctors can really get a good sense of what's going on with the heart's rhythm. This is amazing stuff.
It really is, and there's still so much more that we can learn from a 12-lead. We haven't even touched on things like pericarditis, which also has some really unique features on an ECG that can help distinguish it from other conditions.
Pericarditis, that's the inflammation of the sac around the heart, right? Okay, tell me more. And maybe, knock on wood for me, I don't need any chest pain right now.
Pericarditis can cause chest pain, and that's where the 12-lead becomes so important. It can help us tell the difference between pericarditis and other more serious conditions like a heart attack, which is really important for making sure they get the right treatment.
So how does it do that? What are we actually looking for on the ECG for pericarditis?
The most classic finding in pericarditis is what we call diffuse ST elevation, with kind of a concave upward shape in most of the leads. So that means the ST segment, which comes right after the heart contracts, is elevated across many of the different leads, not just in one specific area like we'd see with a heart attack.
So the pattern of that ST elevation is totally different, and that helps us tell the difference between pericarditis and a heart attack. This is incredibly useful. It's almost like the 12 lead is a whole language, and the more fluent you get, the more it reveals about the heart.
You got it. It's just like learning a new language. But instead of words, we're trying to decipher the heart's electrical signals. And once we can understand that language, we can get a much deeper understanding of how the heart really works.
Well, I am ready to keep learning. What other secrets does the 12 lead hold?
Well, let's look at some real-world examples. Imagine a patient comes into the ER with chest pain. That 12-lead ECG is going to be one of the first things we do. It can help us quickly figure out what might be going on.
Okay, so in an emergency, the 12 lead can point doctors in the right direction. What are some other times when it's really crucial?
It's also really important for monitoring patients during surgery. It can help us assess how well certain medications are working and even evaluate the heart health of athletes. There's really a huge range of applications.
Wow, I had no idea. It really is an amazing tool.
It is. And as we continue this deep dive, I think you'll get an even better understanding of just how powerful and versatile the 12-lead ECG really is.
You mentioned that a 12 lead can help evaluate the heart health of athletes. How does that work?
Well, in athletes, the 12-lead can sometimes pick up on subtle changes that we might not be able to see just from a physical exam. So certain training regimens can actually cause some physiological changes in the heart, like an increase in heart size, or even slight variations in the heart rhythm.
So those changes might be totally normal for an athlete, but the 12 lead just helps make sure there's nothing more serious going on.
Exactly. It's like a safety net. It helps us tell the difference between benign changes from training and potential underlying heart conditions that need more investigation.
That's really interesting. It's like a special tool to make sure those hearts are working at their peak performance, even under all that intense exercise.
Precisely. And it's not just for elite athletes. The 12 lead can be useful for anyone who exercises regularly, especially if they have a family history of heart disease or other risk factors.
It sounds like the 12 lead is becoming even more important for preventative care, too.
Absolutely. Early detection is key for heart health. And the 12 lead plays a really important role in finding those potential problems before they turn into something serious.
You know what I'm realizing? The 12 lead isn't just a tool for diagnosing problems. It's like a window into the overall well-being of the heart.
You got it. It helps us understand the heart's electrical activity in ways that we couldn't even imagine a few decades ago. And as technology keeps advancing, we're going to learn even more about how to use this amazing tool.
Okay, let's shift gears a bit. We've talked about how a 12 lead helps diagnose specific conditions. But what about the interpretation process itself? What are some of the challenges that doctors and nurses face when they're analyzing these ECG readings?
One of the biggest challenges is being able to recognize those really subtle variations in the ECG patterns. Even for the same condition, the ECG can look a little bit different, depending on things like the person's age, their gender, any other underlying health conditions. And believe it or not, even their body position can make a difference.
So it's not as simple as just memorizing a set of rules. There's a lot of nuance involved.
Absolutely. It takes a deep understanding of how the heart works, a really good eye for detail, and the ability to put all the clinical findings together with the ECG data.
I imagine experience plays a big role, too. The more ECGs you've analyzed, the better you get at seeing those subtle differences, right?
Exactly. It's like any skill. The more you practice, the better you get.
Mm-hmm.
But even really experienced clinicians can benefit from continued education and getting feedback from their colleagues to make sure they're staying up to date.
That makes sense. It's all about continuous learning, thinking about this. It must be a lot of pressure to have to interpret these readings accurately.
It is a big responsibility, but it's also incredibly rewarding to know that we're using our knowledge and skills to help people. Every time we interpret an ECG, we have the potential to make a real difference in someone's life, whether it's confirming a benign condition or guiding treatment for a serious cardiac event.
I can only imagine. It must be so gratifying to see a patient recover thanks to your accurate interpretation of their ECG.
It is, and it reminds us that even though we're talking about technology and complex medical concepts, it's really all about improving people's lives.
Well said. Now let's go back to one of the conditions we were talking about before. Myocardial infarctions. We talked about ST elevation as a key indicator, but can you walk me through some of the finer points of interpreting those ST segments.
Of course. So remember, it's not just about whether or not ST elevation is there. It's about where it is, the shape of it, and how much it's elevated.
So there's a lot more information packed into those ST segments than it seems at first glance.
Exactly. For example, the shape of that ST segment can give us some hints about how serious the infarction is. A convex ST segment often means it's a more severe infarction, one that goes through the full thickness of the heart wall.
So the shape of the ST elevation can tell us how deep the damage goes. What about how high it is? Does that matter too?
Definitely. The amount of ST elevation measured in millimeters can be related to how much of the heart muscle is damaged. The more ST elevation there is, the more of the heart is likely affected.
So the higher the ST segment is on the ECG, the more serious the heart attack is likely to be.
In general, yes.
Mm-hmm.
But we always want to look at the whole clinical picture before we make a diagnosis.
That makes sense. It's like piecing together all the clues to get the most accurate picture. Now, you also mentioned that something called reciprocal changes in other leads can be a sign of a heart attack. Can you explain what that means?
Sure. So reciprocal changes are when we see ST depression in leads that are electrically opposite to the leads showing ST elevation. So let's say there's ST elevation in the inferior leads like 233 and AVF. We might also see ST depression in the anterior leads V1 through V4.
So it's like one area goes up and the other area goes down.
That's a great way to think about it. And seeing these reciprocal changes makes us even more suspicious of a heart attack because it suggests that the electrical activity is being disrupted in a specific pattern that usually happens when there's a blockage in a coronary artery.
That's amazing. It's incredible how much information we can get from these simple squiggles.
It really is remarkable. And the more we learn about these patterns, the better we get at diagnosing and treating heart conditions.
You know, as we're going through all these details, I'm struck by how much knowledge and skill it takes to really understand how to interpret 12 lead ECGs.
It takes time, practice, and a desire to keep learning. But the rewards are huge. Being able to read and understand the heart's electrical signals is a true gift, a gift that lets us help people in really amazing ways.
That's beautifully said. It reminds me that even though we're talking about all this technology and these complex medical ideas, it's really all about connecting with people and caring for them.
Absolutely. And as we go deeper into this deep dive, I hope everyone listening will get a better appreciation, not just for how complex a 12-lead ECG is, but also for the hard work and expertise of all the healthcare professionals who use it every day to take care of their patients.
Well said. I'm ready to keep exploring. What other insights are waiting for us in this world of 12-lead ECG interpretation?
Let's talk about another condition where the 12-lead ECG is super helpful, pericarditis. We talked about it a little bit before, but let's dive in a bit deeper and look at the nuances of how it looks on an ECG.
Pericarditis, that's the inflammation of the sac around the heart, right? We talked about that classic diffuse ST elevation pattern. Are there other things we should be looking for on the ECG?
Yes, while diffuse ST elevation is a hallmark of pericarditis, there are some other more subtle features on the ECG that can help us confirm the diagnosis and rule out other things like a heart attack.
Okay, I'm ready to put on my detective hat. What are some of these subtle clues?
One thing to look for is what we call PR segment depression. This is when the PR segment, which is the time it takes for the electrical impulse to travel from the atria to the ventricles, is deflected downwards.
PR segment depression, got it. How does that help us tell the difference between pericarditis and a heart attack?
Well, in a heart attack, we usually don't see PR depression. It's much more common with pericarditis.
So PR depression is another piece of the puzzle that points us towards pericarditis. What else should we be looking for?
Another helpful clue is the shape of the ST segment. Remember how we talked about a convex ST segment being a sign of a heart attack that goes through the whole heart wall? Well, in pericarditis, the ST segment usually has more of a concave upward shape. Sometimes we describe it as saddle-shaped or even smiling.
Okay, so a concave or smiling ST segment is more likely to be pericarditis, while a convex ST segment could mean a heart attack. These little differences are so important for making the right diagnosis.
Exactly, and those are just a couple of examples of the subtle things we look at when we're interpreting ECGs for pericarditis. It's a condition that requires us to be really thorough and pay attention to the details.
You know, as we're talking about all this, I'm really struck by how important the context is when we're interpreting an ECG. It's not enough to just memorize the patterns. We have to understand the patient's symptoms, their medical history, and all the other things that could be affecting the ECG.
You're absolutely right. ECG interpretation isn't a one-size-fits-all kind of thing. It really requires us to understand the whole patient and their individual situation.
Well said. Now, are there any particular challenges or things to watch out for when doctors and nurses are interpreting ECGs for pericarditis?
One challenge is that the ECG findings for pericarditis can change over time. In the early stages, we might see widespread ST elevation, but as the condition progresses, the ST segments might go back to normal, and we might see T wave inversions instead.
So the ECG can actually change along with the condition, which means it's even more important to look at it as part of the patient's overall presentation, right?
Exactly. We need to be aware of these changes and compare the ECG findings with the patient's symptoms, their lab results, and other tests to make sure we're getting the right diagnosis.
So it's a constant process of looking at the evidence and making decisions based on all the available information.
Exactly. And that's what makes 12-lead ECG interpretation such an interesting and challenging field. It's like solving a puzzle where each piece of information gives us a clearer picture.
Well, I'm totally enjoying this deep dive into the world of 12 lead ECGs. I feel like I'm really starting to understand the complexity of the heart's electrical language.
It's been great having you along for the ride. I hope everyone listening is just as excited to keep learning about this amazing field.
I'm sure they are. Now, as we wrap up this section on pericarditis, are there any key takeaways or final thoughts you want to leave our listener with?
I think the most important thing to remember is that even though pericarditis is usually benign and goes away on its own, it can sometimes look a lot like other more serious conditions, like a heart attack on an ECG.
So we need to be able to tell those conditions apart to make sure the patient gets the right treatment.
Absolutely. And that's why it's so important to do a full evaluation of the patient, including a careful interpretation of their ECG to make sure we're making the right diagnosis.
Well said. Now, I can't wait to see what else we uncover in this deep dive. What other parts of 12-lead ECG interpretation are we going to explore?
Let's talk about another group of conditions that have really specific ECG patterns. Bundle branch blocks. We mentioned them briefly before, but let's really get into the details and talk about what they mean clinically.
Bundle branch blocks. Those are the disruptions in the heart's electrical wiring, right? All right, let's unpack those.
Exactly. And they can be pretty fascinating, both in terms of how they affect the heart's electrical system and what they mean for the patient.
Okay, so what are some of the key things we need to know about bundle branch blocks?
First, we need to understand that there are two main types of bundle branch blocks: left bundle branch block, or LBBB, and right bundle branch block, or RBBB.
Okay, left and right, got it. What's the difference between the two?
The difference is in which branch of the heart's electrical system is affected. Think about the electrical signal as a message that needs to get to the ventricles, telling them to contract. The bundle branches are like the pathways that carry that message. If one of those pathways is blocked, the signal gets delayed or messed up. And that creates a specific pattern on the ECG.
So a left bundle branch block means the signal is disrupted in the left bundle branch, and a right bundle branch block means the disruption is in the right branch. Makes sense. But how do we actually see these blocks on the ECG?
That's where things get interesting. LBBB and RBBB both have their own unique ECG features. That let us tell them apart from each other and from other conditions that might look similar.
Okay, I'm ready for some ECG detective work. Let's start with left bundle branch block. What are the telltale signs?
The main sign of LBBB is a wide QRS complex. Remember, the QRS complex shows us the depolarization of the ventricles. That's the electrical event that makes them contract. In a healthy heart, the QRS complex is usually pretty narrow, less than 0.12 seconds long.
Okay, so a narrow QRS is normal. What happens in LBBB?
Well, because the signal is blocked in the left bundle branch, it takes longer for the ventricles to depolarize, and that makes the QRS complex wider, usually longer than 0.12 seconds.
So a wide QRS complex is a red flag for LBBB. Is there anything else?
Yes, there are a few other things we look for. In LBBB, you often see a notched or M-shaped appearance in the QRS complex, especially in leads V5 and V6.
A notched or M-shaped QRS in V5 and V6. So if we see a wide QRS in that M shape, we can be pretty sure it's LBBB.
Exactly. We always consider all the information about the patient, but those are strong signs of LBBB on an ECG.
This is amazing. Now, what about right bundle branch block? How does that look different on the ECG?
RBBB also has a wide QRS complex, but the pattern is a bit different. Instead of that notched M-shaped look, you usually see a slurred RSR prime pattern in the right precordial leads, especially V1 and V2.
Okay, so RBBB looks like a slurred RSR prime pattern in V1 and V2, while LBBB has that M shape in V5 and V6. It's incredible how these little differences in the QRS complex can tell us exactly where the block is.
It is, and these patterns are really helpful when we're figuring out how to treat the patient.
So what does it actually mean for a patient to have a bundle branch block? Is it always a sign of a serious problem?
That's a great question. Bundle branch blocks can be caused by a lot of different things. Some are harmless and some are more serious. For example, they can be completely normal in older adults, just a sign of the heart's electrical system getting older. But they can also be a sign of structural heart disease, like coronary artery disease, cardiomyopathy, or problems with the heart valves.
So just because someone has a bundle branch block doesn't automatically mean something is seriously wrong. But it's important to investigate further to make sure there isn't a bigger problem.
Exactly. How worried we are about a bundle branch block depends on the specific patient, their overall health, and whether they have any other symptoms or abnormalities on their ECG.
That makes sense. We need to consider everything about the patient. Now, are there any specific challenges or pitfalls that healthcare professionals need to be aware of when they're interpreting ECGs for bundle branch blocks?
One challenge is being able to tell the difference between a new bundle branch block and one that's been there for a while, a new bundle branch block, especially if it comes with other ECG changes or symptoms, might be a sign of an acute event, whereas an old stable bundle branch block might not be a big deal.
So it's important to know when the block happened.
Absolutely. Knowing whether it's new or old can really change how we approach the patient. For example, a new LBPB in someone with chest pain could mean a heart attack, while an old LBPB that hasn't changed might not be as worrisome.
It's like putting a puzzle together. We need to look at all the pieces of information to come up with the best interpretation. Now, as we're wrapping up this section on bundle branch blocks, are there any final thoughts or key takeaways you want to leave our listeners with?
The most important takeaway is that bundle branch blocks aren't always a sign of a serious problem, but they should always be evaluated carefully, taking into account the patient's overall health. If you're ever worried about your heart, it's always a good idea to talk to your doctor.
That's great advice. I feel like I understand bundle branch blocks so much better now. What other parts of 12-lead ECG interpretation are we going to explore in this deep dive?
Let's talk about some of the more subtle aspects of ECG interpretation, like how to recognize small variations in the shape of the STT waves and what it means when the electrical axis of the heart is deviated.
Okay, STT wave morphology and electrical axis deviation. Those sound pretty advanced, but I'm up for the challenge.
They are, but with a little explanation, I'm sure you'll get it. And you'll see how these concepts can really help you understand 12-lead ECGs even better.
Well, I'm ready to learn. Let's dive in. Okay, STT wave morphology. That sounds pretty intense. Break it down for me. What are those squiggles all about?
Well, remember how we've been talking about all the different parts of the ECG, like the segments and the waves, the ST segment and the T wave are really important because they show us the heart's repolarization. So that's the electrical recovery phase after the heart contracts.
Okay, so the ST segment and the T wave tell us how the heart is recharging. What kind of variations should we be looking out for?
Even tiny changes in the shape or the direction or how long those waves last can give us clues about a lot of different conditions. Things like ischemia or electrolyte problems or damage to the heart muscle, and even some medications can affect them.
So even small variations can be a sign that something's going on. Can you give me an example of what these STT wave abnormalities might look like?
Sure, so in a patient with ischemia, which means there's not enough blood flow to part of the heart muscle, you might see ST segment depression or T wave inversion.
Okay, so a depressed or inverted ST2 wave could mean ischemia. What about other abnormalities?
Another common one is ST segment elevation, which we talk about with heart attacks and pericarditis. But ST elevation can also happen in other conditions too, like early repolarization, which is a totally benign thing that we often see in young, healthy people.
So ST elevation doesn't always mean a heart attack. That's good to know. But how do we tell the difference between a benign ST elevation and one that's more serious?
That's where the shape and the location of that ST elevation are really important. In early repolarization, the ST segment usually has kind of a concave upward shape, and we see it in several leads, especially the precordial leads. But with a heart attack, the ST elevation is more convex or straight, and it's only in the leads that match up with the area of the heart that's damaged.
So the shape, the location, and the whole context are all important for understanding those ST elevations. This is getting really complex.
It is, and that's why getting really good at interpreting STT wave morphology takes time and experience. But once you understand those subtle variations and what they mean clinically, It really adds a whole new level to your ECG interpretation skills.
Okay, I'm ready for that next level. What about electrical axis deviation? That was the other advanced concept you mentioned.
Right, so the electrical axis basically tells us the overall direction of the heart's electrical activity. You can think of it like an arrow pointing in the direction of the strongest electrical impulse.
So it's like a compass for the heart's electricity.
Exactly. In a normal heart, that electrical axis points mainly toward the left ventricle, which is the biggest and strongest chamber. But certain conditions can make that axis shift either to the left or to the right.
Okay, so the axis can move away from its normal position. What would cause that?
A left axis deviation could mean things like left ventricular hypertrophy, where the left ventricle gets bigger, or a left anterior fascicular block, which is a problem with the conduction system.
So those things pull the axis to the left. What about a right axis deviation?
A right axis deviation can happen with things like right ventricular hypertrophy, right bundle branch block, or even a pulmonary embolism, where a blood clot gets stuck in the lungs and puts extra strain on the right side of the heart.
So by looking at the electrical axis, we can get an idea of which side of the heart might be working harder or having a problem.
That's pretty amazing. How do you actually figure out the axis on an ECG? Is there a special formula or something? There are a few different ways to do it, but one common way is to look at the QRS complexes in leads I and AVF. Those leads give us a snapshot of the heart's electrical activity from the front. So by looking at the direction and the size of the QRS complexes in those leads, we can estimate where the electrical axis is pointing.
So it's like we're triangulating the heart's electrical signals.
That's a great way to put it. It's like using a compass and a map to find the direction of the heart's electrical energy.
You know, the more we talk about these advanced ECG concepts, the more I realize just how complicated and amazing the heart's electrical system is.
It really is, and the 12-lead ECG is an incredible tool that lets us listen to all those signals. It helps us see how the heart is working and find subtle problems that we might otherwise miss.
I have to admit, I'm feeling a little overwhelmed with all this information. It's a lot to take in, but it's also so fascinating. I'm starting to see the 12-lead ECG not just as a medical test, but as a way to understand the heart's secrets, a way to learn its language and see how complex it really is.
That's a great way to think about it. And it's that sense of wonder and curiosity that keeps us learning and exploring this incredible field of cardiology.
Well, you've definitely made me even more curious. I feel like we've just scratched the surface of what there is to learn about 12-lead ECG interpretation. What advice would you give to someone who wants to learn more about this?
I think the most important thing is to be passionate about learning and be willing to put in the work to master this complex skill. There are tons of resources out there like textbooks, online courses, workshops, and conferences. Find what works for you and really dive into the world of ECGs. The more you learn, the more you'll appreciate how incredible the heart's electrical language is.
It's really inspiring advice. I think you've also pointed out something really important. This isn't just about memorizing patterns. It's about really understanding how the heart works and how that's reflected in the ECG. It's about connecting the electrical signals to what's happening with the patient.
It's about seeing the ECG not just as a bunch of squiggly lines, but as a story, a narrative that tells us about the heart's health, its strengths, its weaknesses, and its amazing ability to adapt and overcome challenges.
That's a beautiful way to put it. It's like we're learning to read the heart's autobiography.
Exactly. And with every ECG we interpret, we get better at understanding this language. We become more aware of the subtle details and better able to use what we know to make decisions about patient care.
Well, this has been an incredible deep dive. You've really opened my eyes to a whole new world of knowledge. I feel like I have a new appreciation for how powerful the 12-lead ECG is, and for the amazing work that healthcare professionals do every day, using it to save lives and help people live healthier lives.
It's been a pleasure exploring this with you and with everyone listening.
Yeah.
I hope this deep dive has inspired everyone to keep learning about this fascinating field.
To all our listeners, thanks for joining us on this journey into the world of advanced 12-lead ECG interpretation. Remember, knowledge is power, especially when it comes to your health. Keep learning, stay curious, and take good care of your hearts. All right, let's jump into this deep dive and decode what our hearts are trying to tell us. We're going to be looking at how to spot a heart attack, a myocardial infarction, to be precise, on an ECG.
Right, using a podcast episode called Understanding Myocardial Infarction on the ECG.
Yeah, exactly, from the Healthcare Essentials series. And by the end of this, we're going to be able to recognize those key warning signs. What do you say?
Sounds good. The cool thing about an ECG is that it basically gives us this visual, right, of the heart's electrical activity. And so any disruptions from a heart attack are going to show up on that ECG.
It's like a distress signal. So if a heart attack is happening, What should we look for on the ECG? What are the big red
One of the
flags?
most important things to understand is ST elevation.
Okay, so let's break that down a little. What is the ST segment?
So think of the ECG, as a series of waves and segments. The ST segment is just a specific part of that.
Mm-hmm.
And normally it's pretty flat.
Okay.
But when a heart attack, especially the type called a STEMI, happens,
Mm.
that's when this segment can really shoot upward. Like, imagine a mountain peak popping up on a flat landscape.
And STEMI being the most serious type of heart attack.
Yeah, exactly. It's caused by a complete blockage of one of those coronary arteries.
Yeah.
So essentially, it cuts off blood supply to a part of the heart muscle.
Wow.
The longer that blockage hangs out, the more damage happens.
So those spikes, the upward spikes on the ST segment
Yeah.
are a huge sign that we need to act quickly.
Right.
Wow.
Yes.
Every second counts.
Absolutely.
Now, with a 12-lead ECG, it's like we've got multiple cameras on the heart, right?
Yeah,
Does that help us figure out exactly where the damage is?
absolutely. Each of those 12 leads is like a different angle, a different view of the heart's activity.
Uh-huh.
So doctors can look at which leads show the ST elevation
Yeah.
and get a pretty good idea of, one, what area of the heart is affected, and two, which artery is probably blocked.
So it's like a map to guide the treatment. Could something else cause that ST elevation other than a heart attack?
Oh, that's a great question. And it really highlights why interpreting these ECGs is not always simple.
Right, right.
ST elevation is a strong indicator of a heart attack, for sure.
Okay.
But there are other conditions that can cause it as well. That's why doctors look at the whole picture, not just the ECG.
Okay, so the ECG is a vital clue, but it's not the only piece of the puzzle.
Right.
Now, there was something else mentioned.
Yeah.
They called them reciprocal changes on the ECG. What are those?
Oh, they're really interesting. Basically, you might see, ST elevation in certain leads.
Right.
But then in the leads that are kind of electrically opposite to the area where the heart attack's happening,
Okay.
you might see what's called ST depression. That means the segment dips below the baseline.
Ah, I see.
It's like a mirror image effect.
Okay.
So it gives doctors another clue, to confirm the diagnosis and figure out where that blockage is. But interpreting ECGs, it's a complex thing. Even really experienced cardiologists look at all the evidence, all the clues before they make a diagnosis.
Yeah. It makes sense, yeah. Medicine is as much an art as it is a science, isn't it?
Yeah.
We also saw something about T-wave inversion as a potential warning sign. How's that different from ST elevation?
So ST elevation is more of an immediate sign of that acute blockage,
Mm-hmm.
and heart muscle damage. But T-wave inversion, it can indicate that the heart muscle is strained or not getting enough oxygen, like it's sending out a signal, hey, things are getting a bit tough here.
Okay.
It's a bit more subtle, but still something to take seriously for sure.
So a subtle warning, still something to look into. Now, I've heard T-wave inversion can be caused by a bunch of things, not just heart attacks. Is that right?
Yeah, that's true. It can be a little tricky. Things like electrolyte imbalances,
Okay.
certain medications,
Right.
even just being in really good shape can cause it. But, it could also be a sign of something more serious like ischemia.
Ischemia.
Yeah, so that's when the heart muscle isn't getting enough oxygen-rich blood.
Okay.
This can happen if there's a partial blockage in one of the coronary arteries.
Got it.
It's preventing enough blood from flowing through.
So it's like a canary in a coal mine.
Right.
Warning us about potential problems
Exactly.
before they become huge crises. That's pretty amazing.
It is, and it really emphasizes, why understanding the nuances of these ECG readings is so important. It's not always a clear-cut thing, black and white. There's lots of gray areas.
Yeah.
And the more we learn about them, the better we get at spotting and dealing with, potential heart issues.
This is fascinating, and I feel like we're just scratching the surface. But let's take a quick break to let all this sink in before we go any further.
Yeah.
We'll be back soon to dig deeper into the world of T-wave inversion and other mysteries of the ECG. Stick around. And we're back, exploring those myocardial infarctions on the ECG. We were just talking about how T-wave inversions can be a subtle warning sign.
Right. Not as in your face as that ST elevation, but definitely something to look into. Got to rule out any serious problems. It's like detective work,
Yeah, absolutely. Speaking of detective work, we talked about how recognizing those warning signs can be life-saving, like a race against time.
Oh, yeah, big time.
What happens next? Once those signs pop up, what do doctors actually do?
Well, you're right. It is a race against time. The faster we can get that blood flowing back to the heart, the better. Less damage, better outcome for the patient. Medication's usually the first line of defense. Specifically, we're talking about thrombolytics.
Thrombolytics, those are like the clot busters,
You
or...
got it. They break down that blood clot that's causing the blockage, like sending in a cleanup crew to clear the road.
So just give the medication, blockage is gone.
Well, it's not always that simple. There are times when thrombolytics might not be the best choice. Like if a patient's got a history of bleeding problems or if they've had surgery recently.
Oh.
Thrombolytics could be too risky. And sometimes those clots are just too big or too stubborn for the medication to completely dissolve them.
So what happens then? What are the other options?
That's when we move on to more invasive procedures like angioplasty and stent placement.
Angioplasty, I vaguely remember that. Remind me how that works.
Sure. So basically, they thread this thin catheter with a tiny balloon on the end, right,
Mm-hmm.
into the blocked artery. When it reaches the blockage, they inflate the balloon, pushes the plaque outward, widens the passage.
Like a little inflatable, creating more space.
Exactly.
What about the stent?
Yeah. Often a stent is put in along with the angioplasty. It's for long-term support.
Okay.
It's a little metal mesh tube, expandable, acts like a scaffold, keeps the artery open.
So it doesn't close up again.
Right. Prevents it from collapsing or narrowing again.
Wow, that's amazing. It sounds like pretty delicate work, though.
Oh, absolutely. It requires, special equipment, imaging guidance, and a highly skilled medical team. But being able to quickly open that blocked artery and restore the blood flow, it's critical when treating a heart attack.
Well, it's reassuring to know there are options.
Mhm.
It sounds like doctors have different tools they can use depending on the situation. How do they decide which approach is best?
Great question. It depends on a few things. The location of the blockage, how bad it is, the patient's overall health,
Makes sense.
how long it's been since the symptoms started, and the risks of each procedure. It's a calculated decision made by a whole team of medical professionals.
A team effort. Now, we've been focused on the ECG and the procedures, but I want to ask about the patient. What kind of symptoms might someone be feeling during a heart attack?
Oh, for sure. Chest pain is often the big one,
All right.
but it's not always there. Or it might not even be the worst part.
Really?
Some people, especially women, might have less typical symptoms.
Like what?
Shortness of breath, maybe some nausea, fatigue, or even back pain.
So it's not always what you'd expect.
Exactly. And that's why it's important to remember that heart attack symptoms can be really subtle. It's always best to err on the side of caution.
Right.
Any unusual symptoms, don't wait. Get medical attention immediately. Acting fast can make a huge difference.
That's good advice. It highlights how important it is to know those warning signs, both on the ECG and the physical symptoms. Could literally save a life.
Couldn't agree more. Recognizing the signs and getting help quickly can drastically improve outcomes. Early intervention is key.
We've covered a lot of ground, from the ECG to the life-saving treatments. Let's take a quick pause to process it all. We'll be back shortly to wrap up this deep dive with some final thoughts. Stay tuned.
Welcome back for the final part of our deep dive into myocardial infarctions as seen on the ECG. We've really journeyed through those electrical signals of a heart in distress and explored some amazing interventions. But now it's time to step back and think about the long term. It's interesting, right? We've been focusing on that acute heart attack event, but it's really just one part of a much bigger picture. The journey doesn't just end when the patient goes home from the hospital.
That's a good point. Surviving the heart attack is only the first step. What kind of challenges might someone face later on?
Well, even with quick and successful treatment, there's still a chance of some damage to the heart muscle.
Yeah.
And that can lead to other problems down the road, like heart failure, arrhythmias, or even another heart attack in the future.
So it's not just a one-and-done thing. It sounds like ongoing care is really important.
It is, absolutely. And that's where cardiac rehabilitation comes in. Those programs are really helpful for patients to regain strength, build healthier habits, and ultimately lower their risk of having more heart problems.
I imagine that involves things like diet, exercise, and managing stress.
Exactly. It's all about making lifestyle changes that are good for the heart. Eating a balanced diet, getting regular exercise, finding ways to manage stress, and working closely with doctors to monitor everything and adjust medications or treatment as needed.
So it's a whole person approach, not just the physical heart health, but the emotional and psychological parts of recovery too.
That's so important. Heart attacks are traumatic, both physically and emotionally. We need to address that emotional impact and provide patients with the right support and resources.
Which brings up the role of family and friends. How important are they in all of this?
They're essential. Having a strong support system makes a huge difference in someone's recovery. Loved ones can offer encouragement, help out with everyday things, just be there to listen and offer emotional support. really makes a difference.
It's a reminder that healing goes beyond just the medical side of things, right? It's about human connection and support, helping people get back to their lives.
Absolutely. It's about resilience, building healthier habits, and empowering people to take charge of their heart health.
As we wrap up, it's amazing how much we've learned, but there's still so much more to know. The world of ECGs and heart attack treatment is complex and always evolving.
And that's what's so exciting about medicine. It's a journey of lifelong learning. There's always something new to discover.
And that's a great point to end on. To our listeners, if you're feeling curious, keep exploring. Read those research articles, delve deeper into the ECG, and most importantly, talk to your doctors. Have open conversations, ask questions.
Knowledge is power, especially when it comes to our health. The more we know, the better we can advocate for ourselves and our loved ones.
Thank you for joining us on this incredible journey into the world of myocardial infarctions and the power of the ECG. Until next time, stay curious, stay informed, and stay heart healthy.
All right, so today we're going deep, deep into the electrical secrets of the heart.
Ooh, I like that.
Yeah, and specifically, those electrocardiograms,
ECGs.
ETGs, the squiggly lines that you see on the doctors that it would print out when they're checking out your heart.
Yeah.
Those are like a secret language that your heart uses to communicate.
It really is. And it's amazing because once you start to understand that language, you can hear what your heart's saying.
It's really cool, and that's what we're going to be doing today.
Yeah.
We're going to be focusing on the fundamental pieces of the ECG, the P-wave QRS complex, and the T-wave.
Absolutely.
And by looking at those things, we'll be able to figure out the health and the function of the heart.
Yeah, and you know how you send us your sources and we distill it down to the, essential insights?
Right.
We're going to do that same thing with the ECG.
I like that.
Distilling it down to those key elements that you need to understand what your heart is telling you.
Okay, well, let's jump right in. Let's unpack this thing.
Let's do it.
The first electrical signal that we see on an ECG is the P wave.
Yep.
And it's a small, smooth kind of wave, but it's the spark that kicks off the whole heartbeat sequence.
Yeah.
So what exactly is happening in the heart during that P wave?
So the P wave is really showing us the moment that the atria, the upper chambers of the heart, are electrically activated.
Yeah.
And this electrical signal causes the atria to contract
Right.
and gently push blood down into the ventricles, the lower chambers.
Gotcha.
So you can kind of think about it like priming the pump
Oh, okay.
for the main event.
Okay, so this is like setting up the dominoes.
Yes.
All in a row.
Exactly.
Ready for the main event to knock them all down.
I like that.
That's a great analogy.
Yeah.
So what happens if that first domino, that P wave doesn't fall?
Ah, that is a great question.
Yeah.
If the P wave is absent, means the atria aren't contracting properly.
Oh.
And now this could signal that there's a problem with the sinus node, which is the heart's natural pacemaker.
Right.
Or it might suggest a condition like atrial fibrillation.
Oh, wow.
Where the atria quiver instead of contracting effectively.
Okay, so even that small little blip can tell us so much about the health of the heart.
Absolutely. It can reveal a lot about what's going on.
And that brings us to the next part of this, the QRS complex.
Yes, the main event.
The main attraction, the main act has arrived.
That's right. This is the most prominent feature of the ECG.
Okay.
It represents a much more powerful electrical surge.
So all those dominoes falling.
Yes, exactly.
Right.
This powerful electrical signal is going to cause the ventricles to contract, pushing blood out to the lungs and the rest of the body.
So this is the big show.
It is.
The main event.
It is, and just like you might have different sized dominoes in a set,
Yeah.
the QRS complex actually has 3 different components.
Okay.
The Q wave, the R wave, and the S wave.
Why so many different waves?
Well, think about it like this.
Yeah.
It's an electrical wave traveling through the ventricles.
Right.
And the Q wave is showing us the initial activation of the interventricular septum, the wall separating the 2 ventricles.
Right.
Then the R wave, that's the tall spike that you see.
Right.
That appears as the electrical impulse surges through the main mass of the ventricles.
Okay.
And finally, you have the S wave, which is the signal wrapping around the base of the heart.
Wow, so it's like a wave spreading through the ventricles and we're watching it happen in real time.
Exactly. You got it.
It's incredible.
Yeah. And remember that traffic jam analogy we talked about?
With the P wave?
Yes.
Yeah.
Well, it applies here, too.
Okay.
A wider than normal QRS complex could indicate a delay in the electrical conduction.
Oh, so it slowed down.
Yeah, it's like something is slowing down that wave.
Gotcha. So doctors are looking at not just the presence of it,
Right.
but also the shape of it
The shape and the duration.
to get the full picture.
Exactly.
So what happens after all this excitement? Does the heart get a little break?
Of course, even the hardest working muscle needs a moment to recover.
Right.
That's where the T wave comes in.
So that's like the cool down
Exactly.
after a big workout.
The cool down phase.
Okay.
And the T wave represents ventricular repolarization.
Okay.
It's showing us the electrical activity as the ventricles recover, resetting themselves to prepare for the next contraction.
And if there's problems in that cool down phase or that recovery phase, that can be just as important as the exertion phase.
Absolutely.
Okay.
Any abnormalities in the T wave, like an inverted T wave, where it dips down instead of up, can be a red flag.
Oh, wow.
Potentially indicating a lack of oxygen to the heart muscle or an electrolyte imbalance.
So all of these different waves, the PQRS and the T, they're like pieces of a puzzle.
Yeah.
And we're just putting them together to get that whole picture.
Right now we've covered the basics of each wave.
Yeah.
But the real magic happens when we start to analyze how they relate to each other.
Right.
And the overall rhythm that they create.
Okay.
That's where we'll uncover even more secrets of the heart's electrical language.
I like it. Let's take a quick break and then we'll come back and talk more about it.
Sounds good. Okay, so we've explored these individual peaks and valleys of the ECG, right? The the QRS and the T waves.
Right.
But the story doesn't end there.
Okay.
The spaces between these waves, what we call intervals, hold their own fascinating secrets.
Okay, so we're not just looking at the waves, but we're looking at the spaces between them.
Exactly.
What can those tell us?
Well, think about it this way. The waves show us the electrical events, the contractions and relaxations.
Okay.
But the intervals reveal the timing and the efficiency of the heart's electrical conduction system.
Okay, so how quickly those signals are traveling.
Exactly how smoothly those signals are moving.
Okay, so the waves are the words and the intervals are the grammar.
I like that, yes.
That's a good way to think about it.
That makes the whole sentence make sense. So let's look at one of the most important intervals, the PR interval.
Okay.
This measures the time from the start of the P wave to the beginning of the QRS complex.
So how long it takes to travel from the atria down to the ventricles.
You got it.
Okay.
And just like a well-timed relay race, that electrical signal needs to arrive at the ventricles at just the right time.
Makes sense.
If the PR interval is too short,
it
could suggest an accessory pathway, an extra electrical shortcut.
Like a rogue runner skipping ahead in the relay race.
I like that. Yeah, exactly.
Okay, and what about if it's too long?
If it's too long, that can also throw off the heart's rhythm.
Okay.
A prolonged PR interval can indicate a heart block, a delay or blockage in the electrical pathways.
Okay, so like a runner stumbling and slowing down the whole team.
Exactly. And that disruption in timing can really affect the heart's efficiency.
So interesting how these small little variations in timing can actually signal some crucial information.
Absolutely.
What other intervals are we looking at here?
Another one is the QT interval.
Okay.
This measures the total time it takes for the ventricles to depolarize and repolarize.
Okay, so from the start of the QRS to the end of the T.
You got it. Okay, so basically from contraction to recovery.
Like the whole work cycle.
Exactly. That's a great way to put it.
Of the ventricles.
Yeah. Now, this interval is a bit more sensitive.
Okay.
Its length can be influenced by heart rate, electrolyte imbalances, and even certain medications.
So are there any red flags that we're looking for with this?
A prolonged QT interval
Okay.
can be a serious concern.
Okay.
It's like stretching out that recovery time too much, putting the ventricles at risk for a dangerous arrhythmia called torsades de pointe.
Wow.
Which can be life-threatening.
Okay.
This is why doctors are very careful about medications that might prolong the QT interval.
Right, because it can have some serious consequences.
Exactly.
So it's all about balance.
Yes.
Making sure that the heart is firing at the right time.
Right.
And recovering at the right pace.
Exactly. But remember, we're not analyzing these in isolation.
Yeah.
It's about understanding the interplay between them, the overall pattern and rhythm they create.
Right, the whole picture.
Yes, that tells the real story of the heart's electrical activity.
Like a symphony.
Beautiful.
All those instruments working together.
I like that.
But you need the conductor.
Exactly.
To make sure it all comes together.
Exactly. Now let's zoom out and look at the heart's rhythm, how regular or irregular those beats are.
Okay.
So by analyzing the patterns and the consistency of the P waves, the QRS complexes, and the T waves, we can figure out if the heart's beating in that beautiful symphony you described,
right,
or if there's an arrhythmia.
A disruption in the rhythm.
Exactly.
So a healthy heart would be like a nice, steady drum beat underlying that beautiful symphony.
Yes, very regular, predictable rhythm.
What happens when that gets thrown off?
When that gets thrown off, that's when we start to see the signs of arrhythmias.
Okay.
Now, some are quite common
Yeah.
and relatively benign, while others can be more serious,
Okay.
even life-threatening.
Can you give us an example of what a common one might look like on the ECG?
Sure, let's take atrial fibrillation, or AFib, as an example. It's
Yeah.
one of the most common arrhythmias.
Right.
And it occurs when the atria, those upper chambers,
Yeah.
quiver erratically instead of contracting in a coordinated way.
So it's just chaos in the atria.
A little bit, yeah, instead of a nice, smooth, organized contraction.
How does that appear on the ECG, though?
So in AFib, the telltale sign is the absence of those nicely defined P waves.
Okay.
Instead, you see these rapid, irregular fluctuations,
Okay.
like a choppy, erratic wave pattern.
Oh, sure.
The QRS complexes are still there,
Uh-huh.
but they're happening at irregular intervals,
Okay.
reflecting that chaotic electrical activity in the atria.
So the symphony has been replaced by like a jazz improv session.
I like that, yes, a more unpredictable rhythm.
Okay.
And recognizing these subtle shifts in rhythm is crucial for doctors to diagnose and manage conditions like AFib, which can increase the risk of stroke and other complications.
So we're looking at those individual pieces, but also how it all comes together.
Exactly. It's the overall picture.
The timing, the rhythm, everything.
Exactly. And as we delve deeper, you'll see how each piece of information builds upon the last,
Right.
creating a complex and fascinating portrait of the heart's electrical activity.
We've been through a lot.
We have.
Those peaks and valleys of the ECG waves,
Yeah.
the intervals, the spaces between them,
Uh-huh.
and then how those rhythms can change
Yeah.
from a nice, beautiful symphony to,
A jazz improv.
yeah, a jazz improv session.
I like that analogy.
It's amazing how much
But
information
yeah, it's
is
incredible.
hidden in those lines.
It really is.
But the ECG is just one tool that we have.
It's one instrument in our orchestra of diagnostic tools.
Okay, so we're not just relying on this one thing.
Right.
We're using this in conjunction with everything else that we know about the patient,
Precisely.
their medical history, their symptoms,
Physical exam.
all of that.
Yeah.
So it's like a detective gathering clues.
I like that.
The ECG is one piece of the puzzle,
Exactly.
but you need all the other pieces too.
You got it.
And, I think it's important to say
Yeah.
that sometimes, even if you're looking at an ECG, you might not know what's going on.
Oh, absolutely.
And it's okay to ask for help,
Yeah. Never be afraid to ask for help.
especially from someone who's been doing it for longer or has more experience.
Yeah. ECG interpretation can be incredibly nuanced.
Yeah?
There are complex cases and subtle patterns that require a second opinion or maybe the expertise of a specialist.
So even the most seasoned cardiologists
Oh, yeah.
still need help sometimes.
Absolutely.
And it's a reminder that in this field, you're always collaborating and sharing knowledge.
Exactly. And that leads me to my final piece of advice.
Okay.
Never stop learning.
Right.
Cardiology is constantly evolving.
Yeah, new research and new technologies.
New guidelines all the time.
Absolutely.
So stay curious. Embrace those challenging cases.
And never lose that thirst for knowledge.
I think you've sparked a passion for ECG interpretation in me. This has
Yeah.
been a really great deep dive.
It has been fun.
I feel like I've learned a lot.
Good. I'm glad.
What's one key takeaway that you want to leave our listeners with?
Remember, the ECG isn't just a collection of lines and squiggles.
Right.
It's a direct line of communication
To the heart.
to the heart, a way to listen to its whispers and understand its rhythms.
Yeah.
By mastering this language, you hold the power to unlock the heart's secrets
I like that.
and improve the lives of your patients.
Well, thank you so much for guiding us through this deep dive
It's been my pleasure.
into the world of ECGs.
Keep those stethoscopes ready
Yes.
and those minds curious,
Yeah.
because the heart always has more stories to tell.
And to all of our listeners, thank you for joining us for this deep dive. And until next time, keep those hearts beating strong.
And those minds eager to learn. Hey everyone, welcome back. Today we're doing a deep dive into the world of electrocardiograms. ECGs, for short. You know those squiggly lines doctors use to see what's up with your heart? We're going to try and decode three key parts of the ECG: the PR interval, the ST segment, and the QT interval. They're like clues to your heart health. Our guide for this is episode 7 of Healthcare Essentials. It's a podcast that really gets into the nitty-gritty of these intervals.
Yeah, those intervals are like hidden messages in the ECG. And if you can read them, they can tell you so much about how well your heart's working.
Okay, so to start, can you give us a quick overview of what these intervals represent in the big picture of an ECG?
Sure. So while a lot of people are familiar with the idea of, the main waves on an ECG, the
Hmm.
P wave, QRS complex, and T wave, it's actually often the spaces between those waves that give you the most information. And those spaces are the intervals and segments we're looking at today.
Okay, so I'm picturing a detective story where the ECG is our evidence board. The waves are the big events, and the spaces between them are like the little clues that help us solve the case.
That's a great analogy. So let's start with the PR interval. This interval is the time it takes for that electrical signal to travel from the heart's natural pacemaker, the sinus node, down to the ventricles. The ventricles are the chambers that pump blood out to your body.
Okay, so if the sinus node is like the conductor of the heart's orchestra, the PR interval tells us how long it takes for the conductor's signal to reach the musicians.
Exactly. A normal PR interval is usually between 0.12 and 0.20 seconds, like an orchestra playing in perfect time.
But what happens if that PR interval is longer than it should be? I'm guessing that's where the music starts to sound a little off.
You got it. A prolonged PR interval can be a sign of a heart block, which means there's a delay or blockage in the electrical pathway of the heart, like the signal from the conductor getting lost or delayed on the way to the musicians.
Okay, so a heart block sounds serious. What would that mean for the patient?
Well, there are actually different degrees of heart block. The implications really vary depending on how severe it is.
Hmm.
A first-degree heart block, you might not even have any noticeable symptoms, but a higher degree block could cause things like fatigue, dizziness, or even fainting because your heart's not pumping blood as efficiently.
Yeah, I see. I'm starting to see how these seemingly simple intervals can tell us a lot about what's going on in the heart.
Yeah, it's like peering into this complex machine. Now, on the flip side, a short PR interval could mean the signal's taking a shortcut, bypassing part of the normal pathway.
That's interesting. So it's not just about delays, but also about signals getting there too quickly.
Exactly. This can happen in conditions like Wolff-Parkinson-White syndrome. There's an extra electrical pathway in the heart.
So it's like the electrical signal is like a VIP with a fast pass to the front of the line.
Exactly. And this can disrupt the heart's rhythm, leading to palpitations or even worse, arrhythmias.
Wow, this PR interval is quite informative.
It really is. And it helps us understand the next interval we'll be talking about, the ST segment.
Okay, let's move on to the ST segment then. What does this part of the ECG tell us?
The ST segment shows the time when the ventricles are relaxing and getting ready for the next beat. It's like the heart taking a little break to recharge.
So if the PR interval is about the signal getting to the ventricles, the ST segment is about what happens after the signal gets there.
Yeah. A normal ST segment should be flat, meaning it's at the baseline of the ECG. It's like a nice, calm, and steady heartbeat.
I bet things get interesting when that ST segment isn't flat, though.
You're right. When it goes above or below the baseline, it can mean a problem. For example, an elevated ST segment can be a sign of a heart attack. It's like the heart is under stress and sending an SOS signal.
Okay, a heart attack, that's serious. How does the ST segment help doctors figure out exactly what's happening during a heart attack?
Well, that's where leads come in. Leads are different views of the heart's electrical activity captured by electrodes on the body. Different leads correspond to different parts of the heart. So an ST elevation in certain leads can tell us which part of the heart is being affected during a heart attack.
So it's like having multiple cameras on the heart from different angles, giving you a more complete picture.
Exactly. Now, a depressed ST segment can mean the heart muscle isn't getting enough oxygen. We call that ischemia. It's like the heart is running low on fuel and struggling.
Ischemia sounds like something that needs to be addressed quickly. What happens if it's not treated?
Ischemia can cause chest pain, which we call angina. And if it goes on too long, it can damage the heart muscle. In severe cases, it can even lead to a heart attack.
I see how the ST segment is like another piece of the puzzle. It's not just about the electrical signal, it's about what's happening to the heart muscle itself.
Exactly. And that brings us to our final interval, the QT interval.
Great. Let's dive into the QT interval. What clues can we find there?
The QT interval is the total time it takes for the ventricles to contract and then fully recover to repolarize, which just means to get ready for the next electrical signal.
So if we think of the heart as an athlete, the QT interval is like the recovery time between sprints.
That's a good way to think about it. A normal QT interval is like that athlete recovering quickly and efficiently. But just like with athletes, if that recovery time is too long or too short, it can cause problems.
Okay, so let's talk about those problems. What happens when the QT interval is abnormal?
A long QT interval can be a sign of long QT syndrome. It's a condition where the ventricles take too long to repolarize, like the athlete needing extra rest before they can go again. This can make the heart more likely to have dangerous arrhythmias, which are irregular heartbeats.
Arrhythmias don't sound good. What kind of risks are associated with those?
Well, they can disrupt the heart's rhythm and make it harder to pump blood efficiently, and in some cases, they can even be life-threatening.
Okay, so a prolonged QT interval is something doctors need to take seriously.
Yeah, it can be a sign of something that needs to be addressed.
What about a shortened QT interval? Is that also a cause for concern?
It's not as common as a prolonged QT interval, but yes, a shortened QT interval can also point to some health issues.
So it's like the athlete jumping back into action before they've fully recovered.
Right. A short QT interval can be linked to things like hypercalcemia, which is high calcium levels in the blood, or even certain medications.
I'm noticing a trend here. No matter if the interval is too long, too short, or just right, it tells us something important about the heart's function.
You're absolutely right. These intervals are vital signs for your heart health, just like your pulse or your blood pressure.
This has been a really eye-opening deep dive so far. We've learned about the normal ranges for these intervals, what abnormalities can mean, and even some conditions associated with them. I'm starting to see the ECG in a whole new light.
I'm glad to hear that. We've only just scratched the surface, though. In the next part of our deep dive, we'll look closer at how these intervals are used in the real world and how they actually help doctors make decisions.
I can't wait to learn more. Thanks for joining us on this journey into the heart of the matter. We'll see you back here soon for part 2. Welcome back. So in the last part, we were exploring what the PR interval, the ST segment, and the QT interval can tell us about heart health. Now I'll put on my doctor hat and see how this actually works in real life.
Yeah, let's do it. Let's pretend we're cardiologists and we're looking at an ECG with an abnormal QT interval. So say a patient comes in and their QT interval is longer than it should be. What would you do next?
Well, we know a prolonged QT interval could be a sign of a few different things, like long QT syndrome, electrolyte imbalances, or even side effects from medications.
Right, it's like a medical mystery, and the ECG is our first clue. So what do we do? How do we figure out what's really going on?
I guess like any good detective, you got to start by gathering more information.
Right. Exactly. A good medical history is super important. We want to ask about any family history of heart problems or any sudden cardiac events. We need a list of all the medications they're taking, both prescription and over-the-counter. Because remember, some drugs can actually affect the QT interval.
So we're putting together a case file, trying to piece together the puzzle with every detail we find.
That's a good way to put it. And along with the medical history, we'd probably also order some blood tests. We want to check the electrolyte levels, especially potassium and magnesium. They're really important for regulating the heart's electrical activity.
So if the blood tests come back and show an electrolyte imbalance, that could be the reason for the prolonged QT interval.
Exactly. Sometimes it's as simple as a potassium deficiency that's throwing off the heart's rhythm. And in those cases, fixing that imbalance might be all you need to do to get that QT interval back to normal.
That's good to know that it can be that straightforward sometimes. But what if the electrolyte levels are normal? Where do we look next?
If the electrolytes are fine, we take a close look at the patient's medications. Some medications, like certain antibiotics or antidepressants, are known to prolong the QT interval.
Oh, wow. So even something that doesn't seem related to heart health could be the cause.
It's possible. So in that case, we might think about adjusting the dose or switching to a different medication that doesn't have that side effect.
It sounds like a delicate balance, figuring out the benefits of a medication versus its potential impact on the heart.
It is. It's a conversation between the doctor and the patient, really considering all the options and the risks and benefits.
Now, what if we've ruled out electrolyte problems in medications?
Mm.
What else would we consider?
If those aren't the problem, we might start thinking about long QT syndrome, especially if the patient has a family history of it.
That's right. You mentioned before that long QT syndrome can be inherited.
Yeah. And remember, it's caused by genetic mutations that mess with the heart's electrical system. These mutations can disrupt how ions flow in and out of the heart muscle cells, and that's what leads to a prolonged QT interval.
And I remember you saying that can increase the risk of dangerous arrhythmias.
Exactly. The type of arrhythmia you often see with long QT syndrome is called torsades de pointe. It can be really dangerous.
Wow, that sounds serious. How do you usually treat long QT syndrome?
Well, usually we use a combination of lifestyle changes and medication.
What kind of lifestyle changes would you recommend?
We might tell them to avoid things like really intense exercise or competitive sports. Those kinds of activities can trigger arrhythmias, especially for someone with long QT syndrome. We also might recommend avoiding certain medications, like some decongestants and antihistamines. because they can make the QT interval even longer. And of course, we always emphasize avoiding things like smoking and too much alcohol.
So it's about minimizing anything that could trigger an arrhythmia and making healthy choices.
Right. And on top of the lifestyle changes, we might also prescribe medications like beta blockers. They can help regulate the heart rate and make arrhythmias less likely.
So even though you can't change the genes that cause long QT syndrome, you could do things to manage it and reduce the risks.
Absolutely. Early diagnosis, lifestyle changes, and the right medications can make a huge difference for people with long QT syndrome.
This is all so interesting. It's amazing how these little intervals on the ECG can tell us so much about a person's heart. It feels like we've covered a lot today. Is there anything else you think is important for people to know about the QT interval and how it's used in diagnosis and treatment?
Yeah, we have covered a lot. One important thing to remember is that we've been focusing on the QT interval here, but those other intervals we talked about, the PR interval and the ST segment, are just as important for diagnosing and managing all sorts of heart conditions.
Yeah, you've mentioned a few times that interpreting these intervals really depends on the specific patient and their situation.
Oh, definitely. It's like putting together a puzzle. Each interval is one piece, and we have to look at the whole picture to get it right. The patient's medical history, their lifestyle, other test results, it all matters.
It makes sense. There's no one-size-fits-all in cardiology.
You got it. And that's what's so cool about cardiology. It's a science and an art. We use what we know about the heart, but we also have to be really observant and consider each person individually.
This deep dive has been really eye-opening. We've learned how to read the secret language of the ECG and how important it is for figuring out what's going on with the heart.
I hope so, because the more you know, the better. Understanding even the basics of ECGs can help people take better care of their hearts.
That's so true. And our exploration isn't over yet. We'll be back soon with part 3 of our deep dive. We'll go even deeper into how these intervals are used to make treatment decisions.
Looking forward to it. We'll be talking about how those lines on an ECG can actually save lives.
Until then, keep those hearts healthy. And we'll see you back here soon for the final part of our ECG adventure.
Welcome back to our deep dive. You know, all about electrocardiograms now. We've spent the last 2 parts really getting to know the PR interval, the ST segment, and the QT interval. And those little spaces on an ECG tell us so much about heart health, as we've been learning. Yeah, and now it's time to put all this knowledge to work. Let's see how these intervals actually help doctors make treatment decisions, and even save lives.
Yeah, I'm ready to step into the role of a cardiologist again and see how this all works in the real world. So we've talked a lot about diagnosis, but once you have a diagnosis, what happens next? How do these intervals help guide the actual treatment?
That's a great question. So let's say we've diagnosed someone with long QT syndrome. We know that this puts them at risk for these dangerous arrhythmias, right? So our treatment plan really needs to focus on reducing that risk.
I'm guessing lifestyle changes would be a big part of that.
Definitely. We'd tell the patient to avoid things like really intense exercise or competitive sports. Those can trigger arrhythmias, especially in someone with long QT syndrome. And we might also say to avoid certain medications, like some decongestants and antihistamines can actually make that QT interval even longer.
It seems like a big part of this is educating the patient and really talking to them about why these changes are important.
Oh, absolutely. People are much more likely to stick with lifestyle changes if they understand the reasons behind them.
What about medication? Would that be part of the plan for long QT syndrome?
Yeah, often we'll prescribe medications to help manage it. Beta blockers are pretty common. They can slow down the heart rate and make those arrhythmias less likely.
So even though you can't change the genes that are causing the long QT syndrome, you can use medication to kind of control how it affects the heart.
Exactly. It's like giving the heart some extra support to help it work better and more safely.
What if medication and lifestyle changes aren't enough? Are there any other options for treating long QT syndrome?
Yeah, sometimes you need something a little more intense, I guess. Like, we might recommend an implantable cardioverter defibrillator or an ICD.
What's an ICD? How does that work?
Well, an ICD is a little device that gets implanted under the skin, usually near the collarbone, and it's always monitoring the heart rhythm. So if it detects a dangerous arrhythmia, it can actually deliver an electrical shock to get the heart back into a normal rhythm.
So it's like having a personal bodyguard for your heart.
Haha, that's a good way to put it. ICDs can be lifesavers for people who are at high risk for sudden cardiac arrest.
This deep dive has really shown that treating heart conditions isn't a one-size-fits-all kind of thing.
Definitely not. Every patient is different. Their treatment plan needs to be specific to them and their situation. We look at their medical history, their lifestyle, what they prefer, how serious their condition is. All of that goes into making decisions.
It really is both an art and a science, isn't it?
Yeah, it is. Cardiology is constantly changing. But the main goal is always to use everything we know to help our patients and, help them live longer and healthier lives.
This deep dive has been so eye-opening. We've learned how to decode the secrets of those squiggly lines on an ECG. And we've seen how important they are for diagnosing and treating heart conditions.
Yeah, and most
Huh.
importantly, we've seen how understanding all of this can help people take better care of their hearts.
That's so true. This information isn't just for doctors and nurses. It's for everyone.
Yeah, the more you know about your heart, the better. This deep dive is really just the beginning.
Thank you for joining us on this adventure into the world of electrocardiograms. It's been so much fun. And until next time, stay curious and keep on learning.
All right, let's dive right into the world of ECGs.
Yeah.
I know they can look a little intimidating at first,
Yeah.
kind of like a secret code almost.
Right.
But once you understand the basics, it's really fascinating. It's like you're unlocking a window into the heart.
Yeah, absolutely.
And today we're going to be focusing on heart rate and rhythm, two really crucial elements when you're looking at an ECG.
Absolutely. Those are the fundamental aspects that you want to look at when you first get an EKG. It's like taking a pulse.
So let's say we have an ECG right in front of us. Where do we even begin?
Well, the first thing we want to assess is the heart rate,
Okay.
which is basically how many times the heart beats per minute. And believe it or not, you can actually figure that out
Right.
by just looking at the spacing between the heartbeats on the ECG.
So we're not counting every single peak and valley on that tracing.
Not exactly, no.
Mhm.
We're mainly focusing on the R wave, which is that prominent peak that you see.
Okay.
And that represents the ventricular contraction, so the big squeeze of the heart. So picture it like this. Each R wave is like a powerful footstep propelling blood out to the body.
Okay, so like a rhythmic march of footsteps.
Exactly. And the interval between those R waves, what we call the RR interval,
Okay.
that's essentially the time between those powerful heartbeats.
Okay, so like measuring the space between each footstep in that march.
Precisely.
Gotcha. So how do we actually use those R waves or those footsteps to actually calculate the heart rate?
Well, there are a couple of neat tricks that we use.
Ooh, tricks.
Yeah, so let's start with a scenario where the rhythm is nice and regular.
Okay.
Those footsteps are evenly spaced,
Okay.
like a well-rehearsed marching band.
Gotcha.
In this case, we can use what's called the counting method.
All right, let's break down this counting method. How does it actually work?
So imagine we found 2 consecutive R waves on our ECG. They're like 2 peaks on a mountain range.
Okay.
The first step is to measure the distance between them. That's our RR interval.
Right.
Now, each tiny square on the UCG paper represents 0.04 seconds. So we simply count the number of small squares between our 2 R-wave peaks.
So it's like taking a tiny little ruler to measure those heartbeat intervals.
Precisely. And here's the magic. To calculate the heart rate, we divide 1,500 by the number of small squares we just counted.
Wait, why 1,500? Is there some secret code I'm missing here?
No, it's just a mathematical shortcut that takes into account the time represented by each small square.
Okay.
So let me give you an example. Imagine you count 30 small squares between those R waves.
Okay.
You divide 1,500 by 30, and you get a heart rate of 50 beats per minute.
Oh, okay, that makes sense.
Yeah.
So it's a nice, precise way to get a clear picture of that heart rate, especially when the rhythm is nice and steady.
Exactly. But what happens when those footsteps become a bit more erratic?
Yeah.
Like a jazz solo with some unexpected pauses and syncopations.
Right. Things are bound to get a little bit more complex then.
Exactly. So that's when we turn to our second trusty tool,
Oh, okay.
the 6-second method. This one's great for those unpredictable rhythms.
Okay, so instead of meticulously measuring each interval, we're taking a broader view, kind of.
You got it.
Okay.
So we find a section on the ECG that's clearly marked as a 6-second strip.
Right.
Think of it like a snapshot of the heart's rhythm over a brief period.
Gotcha.
And then we simply count how many R waves, those ventricular contractions, occur within that 6-second window.
So it's less about the precision and more about getting a quick assessment of the overall heart rate, even if it's a little chaotic.
You nailed it. And to get the beats per minute, we simply multiply the number of R waves in that 6-second strip by 10.
Okay.
Let's say we counted 8 R waves.
Okay.
Multiply that by 10, and we get a heart rate of 80 beats per minute.
See, easy peasy.
Yeah, not so bad.
Two different approaches for two different rhythm scenarios.
Right.
But even with those calculations, I feel like we're just scratching the surface here. I mean, beyond the numbers, Why should we care so much about heart rate in the first place?
That's an excellent question. And it's important to remember that heart rate is a vital sign, just like your temperature or your blood pressure.
Right, it's not just some abstract number. It's really reflecting what's going on inside the body.
Precisely. And a high heart rate, for instance, could indicate stress or exertion or even an underlying medical condition.
Right.
On the other hand, a very low heart rate might suggest an issue with the heart's electrical system.
Oh, okay.
So it's all about context.
So even within what we consider to be a normal range, there's a lot of nuance to consider.
Absolutely. And that's why it's so important to not just look at heart rate in isolation, but to consider it in conjunction with other factors, including the rhythm.
Right, rhythm. We talked about regular and irregular rhythms when we were talking about those calculation methods, but what does that actually mean?
Well, think of it this way. The heart has its own internal conductor, an electrical system that keeps everything synchronized.
Okay.
In a regular rhythm, that conductor is doing a stellar job,
Right.
keeping those heartbeats nice and steady and consistent.
Yeah, like a perfectly timed metronome kind of guiding the orchestra.
Exactly. But I imagine things can get a little offbeat sometimes.
Right. And when that happens, we see what's called an irregular rhythm on the ECG.
Exactly.
Okay.
Now, this doesn't always mean something's wrong.
Right.
Sometimes those slight variations in heart rate are completely normal.
Yeah, like sinus arrhythmia,
Yes,
where the
exactly.
heart rate kind of speeds up when you inhale and slows down when you exhale.
Precisely. And sinus arrhythmia is actually a sign of a healthy heart responding appropriately to changes in your breathing patterns.
So it's like the heart is having a little conversation with the lungs.
Exactly. It's all connected.
Okay.
But there are other types of irregular rhythms that can signal something more serious.
Okay.
Conditions like atrial fibrillation or premature ventricular contractions.
Right. So then it's like the conductor's having a little bit more trouble keeping everyone in sync.
Exactly. And understanding those different types of irregular rhythms and what they might indicate is really a crucial part of ECG interpretation.
It's fascinating how everything's kind of intertwined. The heart rate, the rhythm, the underlying electrical activity of the heart.
It's like a fascinating puzzle, and each piece contributes to the overall picture of the heart's health.
Well, before we get too lost in the intricacies of irregular rhythms, I kind of want to make sure our listeners are still with us.
Right.
We covered a lot of ground so far.
Sounds like a good plan.
So just a little recap for our listeners out there.
Exactly.
So imagine you're now holding an ECG in your hands.
Yeah.
The first thing you would assess is the heart rate.
Exactly. And we have two handy methods for that. The counting method.
Right, for those nice regular rhythms.
Yeah, and then the 6-second method for when things get a little more unpredictable.
Exactly. But it's not just about the number itself. You have to take it into consideration with all the other factors.
Precisely. Consider the context, the patient's history, other factors that might be influencing their heart rate.
Right. And equally important, you have to pay attention to the rhythm. Is it regular, like a well-rehearsed symphony, or are there some unexpected deviations?
Exactly. And as we delve deeper into the world of ECGs, you'll learn to recognize those subtle variations in rhythm and what they might signify.
This is where things get really exciting. It's like becoming a detective searching for clues hidden within those squiggly lines.
Precisely. And with practice, you'll develop the skills to spot those clues and connect them to the bigger picture of cardiovascular health.
Before we jump into the fascinating world of irregular rhythms and those various patterns, I just want to pause here for a moment.
Yeah.
You know, I love those aha moments.
Do indeed.
Those little sparks of insight where everything kind of clicks into place.
Absolutely.
What's caught your attention so far?
Well, I'm eager to hear your aha moments. What have you noticed?
Well, for me, it's the realization that even the simplest elements of an ECG, like those RR intervals,
Yeah.
can hold so much information.
Yeah.
It's like a secret code waiting to be deciphered.
It is.
That's fascinating to me.
That's a great observation. And as we progress, you'll find that those seemingly simple elements are really the foundation for understanding more complex cardiac concepts.
So to our listeners out there, I encourage you to take a moment, let all of this sink in.
Yeah.
Imagine yourself holding that ECG, tracing those R waves, calculating that heart rate.
Mm-hmm.
Can you feel that sense of discovery, that thrill of unraveling the mysteries of the heart?
And remember, this is just the beginning of our journey.
Oh, yeah.
We've only just dipped our toes into the vast ocean of ECG knowledge. There's so much more to explore.
And explore we shall.
Yeah.
But for now, let's take a little break and come back refreshed and ready to tackle those fascinating irregular rhythms.
Sounds good. Welcome back. So are you ready to dive into those irregular rhythms?
Let's do it. I'm ready.
All right, so as we were discussing, these rhythms can sometimes, just be a sign of a healthy heart.
Right, like with that sinus arrhythmia.
Exactly, but other times they can actually signal something a bit more serious, so it's important to be able to distinguish between the two.
Right, it's like a red flag waving saying, hey, pay attention.
Precisely.
Huh.
But with so many different types of irregular rhythms, I can see how it can be a little overwhelming.
Yeah.
Where do we even begin?
Yeah. Where do we begin?
Well, one way to approach it is to think like a detective, right?
Okay.
We can actually look for specific patterns within those irregular rhythms.
Gotcha.
And each pattern tells us a story about what's happening in the heart.
So it's not just about whether the rhythm is regular or irregular, but about the specific way that it's irregular.
You got it.
Okay, cool. So are there any common patterns that we should be looking out for?
Absolutely. Let's start with one you might have heard of.
Yeah.
Premature atrial contractions, or PACs.
Pixies, okay. Yeah, I've heard of those. Those are just like extra heartbeats that happen too early, right?
Exactly. Think of it this way. The heart's normal rhythm is like a steady drum beat.
Okay.
But with a PAC, you get an extra beat that comes in just a little too soon, like the drummer hitting the snare a fraction of a second early.
Okay, so it's like a skipped beat in a song.
Precisely, a little hiccup in the rhythm.
Okay. But is that something to worry about?
Well, most of the time, PACs are harmless, especially in people without any underlying heart conditions.
Oh, okay.
They can be triggered by things like stress or caffeine or even just lack of sleep.
So if you're feeling those extra heartbeats after a late night coffee binge, maybe cut back on the caffeine a little bit?
Exactly.
Good advice.
But it is important to note that in some cases, frequent PACs can actually be a sign of an underlying heart problem, so it's always a good idea to discuss it with your doctor.
Right. Better safe than sorry.
Exactly.
So PACs are those early beats that throw off the rhythm. Are there any other common patterns that we should be aware of?
Absolutely. Another one we see pretty frequently is premature ventricular contractions, or PVCs.
PVCs, okay. They sound a little more serious. What's the difference between those and PACs?
Well, with PACs, the extra beat originates in the atria, which are the upper chambers of the heart.
Okay.
But with PVCs, that extra beat comes from the ventricles, which are the lower chambers.
And why does that matter? I mean, don't all heartbeats essentially do the same thing, pump blood?
That's a great question. While all heartbeats do involve pumping blood, the ventricles are really the powerhouses of the heart.
Okay.
They're responsible for pumping blood out to the entire body.
So if the ventricles are throwing in these extra beats, it's kind of a more forceful disruption of the rhythm.
Exactly. PVCs can feel more pronounced, like a strong thump or flutter in your chest.
Okay, so now I'm starting to understand why PVCs might be more concerning.
Right.
But like PACs, are they always a sign of something serious?
Not necessarily.
No.
Occasional PVCs are actually quite common, especially in healthy individuals.
Okay.
They can be brought on by things like exercise or stress or even certain medications.
So again, context is key.
Precisely.
It's about looking at the whole picture. Someone's overall health, their lifestyle, all those other factors.
But it's important to note that if PVCs become very frequent or they start to occur in certain patterns, they could indicate an underlying heart problem that needs further investigation.
Right, those patterns, again, hold the clues. They kind of tell you whether you should be concerned or not.
Exactly. And learning to recognize those patterns is really a key skill for anyone who works with ECGs. It's like learning a new language, the language of the heart.
So we've got PACs with those early beats originating in the atria, PVCs with those more forceful extra beats coming from the ventricles. Are there any other patterns that we should be familiar with?
Yes, there's one that's particularly important to recognize, and that's atrial fibrillation, or AFib.
AFib. Okay, yeah, I've definitely heard of that one. That's when the heart rhythm is just totally chaotic, right?
That's a good way to put it.
Okay.
So in AFib, the electrical signals in the atria become very disorganized,
Okay.
causing them to quiver instead of beating effectively.
So it's like the conductor has lost control of the orchestra and everyone's just playing their own tune.
Exactly. And because the atria aren't contracting effectively, blood flow through the heart can become disrupted.
Okay.
And this increases the risk of blood clots forming, which can then travel to the brain and cause a stroke.
Wow. Okay, that's serious. So AFib is definitely not something to take lightly. How do we spot it on an ECG? Is there a certain pattern that we look for?
Yes, the hallmark of AFib is the absence of those clear, distinct P waves that we talked about earlier.
Right, the P waves.
Remember, the P wave represents the electrical activity of the atria.
Okay.
But in AFib, those P waves become replaced by a rapid, irregular bass line, almost like a jumbled mess of electrical signals.
So instead of those nice, neat little bumps that indicate the atria are contracting in sync, we see this erratic baseline that reflects that chaotic electrical activity.
Precisely. And the RR intervals, those spaces between the ventricular contractions, also become completely irregular.
So if we see that absent P wave and that totally irregular rhythm, it's a pretty clear sign of AFib.
In most cases, yes.
Oh,
But it's important to remember that there are different types of AFib,
right.
and the patterns can be subtle sometimes.
So even within the world of irregular rhythms, there's different levels of complexity and nuance.
Absolutely. And that's why it's so important to have a good understanding of the underlying physiology and the different ways it can manifest on the ECG.
It's like you're becoming a master code breaker. You're learning to decipher the subtle clues hidden within those squiggly lines.
Exactly.
But for our listener who might not be a seasoned ECG expert, what's the main takeaway here? What's the most important thing to remember about these irregular rhythms?
I think the most important thing is to remember that not all irregular rhythms are created equal.
Okay.
Some, as we talked about, can be completely benign, while others can signal a serious underlying condition.
Right. So don't panic if you see a few extra beats or the rhythm is a little off,
Exactly.
but don't ignore it either.
Right. The key is to be aware of those different patterns,
Hmm.
understand their potential significance, and always seek professional medical advice if you have any concerns.
This has been incredibly insightful. I'm starting to feel like I can actually read those ECG squiggles now.
I'm glad to hear that.
But before we wrap things up, I'm curious, in your experience, what's the most common mistake people make when it comes to interpreting heart rhythm?
It's a good question. You know, I think one of the most common mistakes is oversimplifying things.
Okay.
People tend to just focus on whether the rhythm is regular or irregular,
Hmm.
without really considering those specific patterns or the underlying causes.
Right, so it's like trying to diagnose an illness based on one symptom without looking at the patient's history and lifestyle and everything else.
Exactly. It's about seeing the whole picture, not just a single piece of the puzzle.
Right. And speaking of the bigger picture, I think it's time to zoom out a bit
Okay.
and give our listeners a chance to process everything we've covered.
Sure.
We talked about heart rate, rhythm, those fascinating irregular rhythms.
It's been quite a journey, hasn't it?
It has.
From measuring those RR intervals to recognizing those subtle variations in rhythm. We've really delved into this intricate world of the heart's electrical system.
Yeah, and we've encountered those really fascinating irregular rhythms.
Yes.
The PACs, PVCs, AFib,
Mm-hmm.
each with their unique patterns and potential implications.
It's like learning a new language.
Yeah,
A language that allows us to understand the heart's secret conversations.
it really is. It's fascinating.
And with practice, anyone can become fluent in this language.
Absolutely. So to our listener, I want you to take a moment and just reflect on what you've learned.
Yeah.
Imagine yourself looking at an ECG,
Uh-huh.
identifying those key features,
Right.
recognizing those telltale patterns. Can you feel that sense of accomplishment, that excitement of unlocking the secrets of the heart?
And remember, this is just the beginning of your ECG adventure.
Oh yeah, just the beginning.
There's so much more to discover, so much more to learn.
And as we delve deeper into this world, those seemingly complex ECGs become more and more comprehensible.
Right.
It's like a puzzle that starts to come together, revealing a clearer picture of the heart's health.
It's a journey of continuous learning and a journey that can lead to some incredible insights.
Absolutely. Speaking of insights, do you have one final piece of wisdom you'd like to share with our listener before we wrap up this deep dive?
Yeah, I think the most important thing to remember is that even with all the technological advancements that we've had in cardiology, the human element remains paramount.
Oh, I like that.
It's about combining our knowledge of ECG interpretation with our clinical judgment, our empathy, and our ability to connect with our patients.
That's a beautiful reminder that medicine is more than just science. It's also about compassion, understanding, and that desire to really help others.
Precisely. And with that in mind, let's take a final pause before we conclude our deep dive.
Mm.
And I'd love to hear what stood out to you the most during our exploration of heart rate and rhythm. Was there a particular concept or a specific pattern, or maybe just a new way of looking at ECGs?
Yeah, for me, it was like when we were talking about PACEs and PVCs, and it just clicked in my head that, they're both these extra heartbeats,
Right.
but the fact that they originate in different places, the atria versus the ventricles, makes a huge difference in how we interpret them.
It really does. Those little distinctions can make all the difference.
Yeah, exactly. It's like those little details are the biggest clues.
Absolutely.
So, speaking of clues, I think we've given our listeners a whole toolbox to start figuring out these ECGs.
I hope so.
But before we go, I want to leave them with something to think about.
Okay.
Imagine you're a cardiologist, you're looking at an ECG. What else are you looking at besides just heart rate and rhythm to figure out how healthy someone's heart is?
That's a great question, and it's something to keep in mind as you continue to learn more about ECGs. Heart rate and rhythm, they're essential, but there's so much more information packed into those waveforms.
Right.
You've got the shape and the duration of each wave, the intervals between them, the electrical axis of the heart. All these things contribute to the overall picture.
It's like those squiggly lines are whispering secrets, and we just have to learn how to listen.
Exactly. And as you gain experience, you start to pick up on those subtle patterns, things you might have missed before.
It's a constant journey of discovery.
It really is.
And we encourage everyone out there to keep learning, keep exploring this fascinating world of cardiology. Who knows what incredible things you might find.
Absolutely. Keep those curious minds engaged.
That's right. Stay curious, everyone. And until next time, keep those hearts beating strong.
That's a great way to put it.
Hey, everyone. Ready to become EKG detectives?
EKG detectives, I like
Well,
this.
today we're going to crack the code of common ECG abnormalities. You know those squiggly lines that tell us so much about the heart's electrical activity?
Yes, the heart's secret language.
Exactly. We'll be focusing on atrial fibrillation, ventricular tachycardia, and those tricky heart blocks. And to guide us, we've got some awesome insights from this podcast we found. Super clear explanations, even I could understand them.
Fantastic. Those are some of the most common, yet sometimes misunderstood ECG abnormalities.
So let's jump right in. Where should we start?
Well, how about with atrial fibrillation, or AFib as it's often called?
Yeah.
It's where the heart rhythm gets all, well,
Irregular.
irregular, huh?
Yeah.
So not like a nice steady beat.
Yeah, not steady at all. And often pretty fast, too. It's like the top chambers of the heart, the atria, are just kind of quivering instead of beating properly.
Quivering. So what causes that? Faulty wiring.
It's all about those electrical signals in the heart. In AFib, those signals get all messed up and disorganized. So that's why the heart rhythm goes haywire.
Exactly. And you can actually see this chaos on an ECG. The P waves, which normally show the atria contracting, are either missing or look really erratic.
So no nice, neat little bumps for the P wave.
Nope, not an AFib. And the spacing between the heartbeats is uneven too.
Wow. So it's really obvious when you look at the ECG.
Oh yeah, the pattern's pretty distinctive. Now, even though AFib might not be an immediate emergency, it's definitely not something to ignore.
Right, because it can lead to some serious problems down the line.
Yeah, it can significantly increase the risk of stroke and heart failure over time. So yeah, early detection is key.
Okay, so I'm picturing this chaotic rhythm on the ECG, but I'm guessing there are different types of AFib, right? Like some worse than others.
You got it. There are several subtypes, each with their own quirks and implications.
Quirks, huh? So tell me about them.
Well, there's paroxysmal AFib, where the irregular rhythm comes and goes. And then there's persistent AFib, where the irregular rhythm is basically constant.
So it's not always a steady state. It can fluctuate.
Exactly. And that's why interpreting the ECG, along with knowing the patient's history, is so important.
Okay, got it. Moving on to our next suspect, what about ventricular tachycardia? Or VTAC for short.
Ooh, VTAC. That one's a bit more serious.
Yeah, it sounds a lot more intense than AFib.
Well, it originates in the ventricles, the heart's main pumping chambers, and it causes the heart rate to get dangerously fast, like way faster than it should be.
How fast are I talking?
Well over 100 beats per minute, sometimes even 200 or more.
Wow, that's like the heart's on overdrive. So how does VTAC look different from AFib on an ECG?
Oh, it's pretty dramatic. You see these really wide, bizarre-looking QRS complexes.
Bizarre. In what way?
Well, they're wider than normal because the electrical signal's coming from the ventricles themselves, not following the normal path.
So the shape tells us where the signal's coming from. That's pretty cool.
Yeah, it's like a little road map. And often, you won't see any clear P waves in VTAC either. It's like the atria are being completely drowned out by the crazy activity in the ventricles.
I see. So what makes VTAC so dangerous? Is it just the super fast heart rate?
Well, that's part of it. A heart beating that fast can't pump blood effectively. But the real danger is that VTAC can quickly turn into ventricular fibrillation.
Ventricular what now? That doesn't sound good.
It's not good at all. It's a completely chaotic rhythm, and it can lead to sudden cardiac arrest.
Oh, wow. Okay, so if we see VTach on an ECG, we gotta act fast.
Absolutely, it's a medical emergency.
Got it. So before we move on to heart blocks, anything else we should know about VTach?
Well, just like AFib, there are different types of VTAC, some more worrying than others, and the causes can vary too.
Like what kind of causes?
Could be things like coronary artery disease,
Meh.
heart attacks, even electrolyte imbalances.
Okay, lots to consider there. Well, on to our final ECG mystery for today, heart blocks. I'm picturing a traffic jam in the heart's electrical system.
That's a great way to think about it. It's like the electrical signals from the atria have trouble getting through to the ventricles.
Huh, a traffic jam. So what causes this blockage?
Well, imagine the electrical signals as cars on a highway. Sometimes there's a delay or even a complete roadblock preventing the signals from getting to their destination.
So is that why the heartbeat gets slow or irregular?
Exactly. And how severe the heart block is depends on how much the signal is disrupted.
Right, I remember we talked about different types of heart blocks, like different levels of traffic congestion, right?
Exactly. We've got first degree, second degree, and third degree heart blocks. And they each have their own unique ECG patterns and potential complications.
Okay, before we get into those, I have a question. These electrical pathways in the heart, are they like actual wires? What's getting blocked?
Ah, good question. Instead of physical wires, we have specialized cells that conduct those electrical impulses.
So a heart block happens when something disrupts those cells.
Exactly. Could be damage from a heart attack, scarring from surgery, even just the aging process.
Wow, so lots of potential culprits.
Yep. And where that blockage happens determines what kind of heart block we're dealing with.
Okay, so let's break it down, starting with first-degree heart block. Is that like a minor fender bender on our electrical highway?
That's a good way to put it. It's the mildest form. Just a slight delay in the signal getting from the atria to the ventricles.
So more of a speed bump than a roadblock.
Right. The rhythm stays regular, and every signal still triggers a ventricular contraction. But you'll see a prolonged PR interval on the ECG.
Meaning?
The time between the P wave and the QRS complex is longer than it should be.
Gotcha. So the signal's a bit slow, but it still gets there. What causes that delay anyway?
It could be a minor conduction issue, maybe due to aging or certain medications.
And is it always a big deal? Do you always need treatment?
Not always.
Yeah.
First-degree heart block often doesn't cause any symptoms and might not need specific treatment.
Okay, that makes sense. So let's talk about second-degree heart block. What happens when the traffic jam gets a bit worse?
Well, with second degree, some of those electrical signals just don't make it through to the ventricles at all.
Ah, so some cars get stuck while others sneak through.
Exactly. Now, there are two main types of second-degree heart block, each with its own unique pattern on the ECG.
Lay it on me.
Okay, so type I, also called Wenckebach, is like a gradually worsening traffic jam. The PR interval gets longer and longer until a signal is completely blocked, and then you get a dropped QRS complex.
A dropped beat. So it's like the signal just gets too weak to make it through.
Exactly. And then the cycle starts again, with the PR interval gradually lengthening before another beat is dropped.
Wow, that's fascinating. What about type 2?
Type 2 is more like a sudden road closure. The PR interval stays the same, and then boom, a QRS complex just vanishes.
No warning, just a sudden dropped beat.
Yeah, that's type 2. And it's generally considered more serious than type I because those dropped beats can happen more often and without warning.
So it's more likely to turn into a complete heart block.
Right. Okay, now for the big 1/3 degree heart block.
Uh-oh. That sounds ominous. What's happening here? Total gridlock.
Pretty much. It's like the highway's completely closed. No signals from the atria can reach the ventricles at all.
So the atria and ventricles are totally out of sync.
Exactly. The atria are beating at their normal rate, but the ventricles have to rely on a slower backup pacemaker located further down in the heart.
Wow, so the heart's basically running on a backup generator.
You could say that, and because of that, the heart rate is usually really slow in third-degree block, like dangerously slow.
Okay, this definitely sounds like an emergency. What causes such a severe blockage, and what can you do about it?
Well, the causes can vary. Could be severe coronary artery disease, damage from a heart attack, certain medications.
So same suspects as with the other abnormalities.
Pretty much. But the treatment's often different. For most cases of third-degree heart block, a pacemaker is the go-to solution.
Ah, the pacemaker, our trusty backup conductor.
Exactly. It keeps the heart beating at a steady rate and prevents those super slow heart rates that can cause all sorts of problems.
So instead of relying on that slower backup pacemaker in the heart, You install a little device that can do the job more reliably.
Right. It sends out those electrical impulses and keeps everything running smoothly.
Amazing. It's incredible how technology can step in and help the heart do its job.
It really is. Pacemakers have been a game changer for people with heart block.
Welcome back, everyone. So we've learned to spot those telltale patterns of AFib, VTach, and heart blocks on an ECG. But I'm guessing there's more to the story, right? It's not always as simple as just seeing the abnormality and bam, you know exactly what's going on.
You're absolutely right. It's kind of like seeing smoke. You know there's probably a fire somewhere, but you need to investigate further to figure out where it's coming from, how big it is, and how to put it out.
So how do you go from seeing that smoke on the ECG to actually figuring out what's causing it and how to treat it?
Well, the patient's medical history is super important. We need to know about their symptoms, any other health problems they have, family history of heart issues, even their lifestyle.
So it's like detective work. You gather clues from everywhere.
Exactly. And sometimes we need to call in for backup, so to speak, by ordering additional tests.
Like what kind of tests?
Well, an echocardiogram, for instance, can show us how the heart's structure and function are doing.
So it's like getting a sonogram of the heart to see how it's actually moving and working.
Precisely. We can see if the valves are working right, if the heart walls are thickened, if there's any part of the muscle that's not contracting properly.
Wow, pretty high tech.
It is. And another handy tool is a Holter monitor.
A Holter monitor. Remind me what that is again?
It's a portable device that records the heart's rhythm continuously for a day or even longer.
So you get to see the heart's activity over a longer period, not just a snapshot in time.
Right. And that's especially useful for patients who have symptoms that come and go, like palpitations or dizziness. They might have a normal ECG in the doctor's office, but the Holter monitor can catch those fleeting arrhythmias.
Makes sense. So once you've gathered all the evidence and you've got a diagnosis, what happens next? How do you actually treat these abnormalities?
That's where the real challenge in the art of medicine comes in. The treatment plan really depends on a lot of things: the type of abnormality, how severe the symptoms are, the patient's overall health, even their personal preferences.
Ah, so it's not a one-size-fits-all approach.
Not at all. It's about finding the right strategies to manage the condition and improve the patient's quality of life.
All right, let's dive into some of those strategies then. What about AFib, for example? What are the main treatment options there?
Well, with AFib, we're usually focusing on two main goals: controlling the heart rate and preventing stroke.
Makes sense. A racing, irregular heartbeat can't be good, and we've already talked about how AFib increases the risk of stroke.
Exactly. So medications are often the first line of treatment. There are meds like beta blockers and calcium channel blockers that can help slow down the heart rate and make it more regular. And to prevent strokes, we often prescribe blood thinners.
So it's like a two-pronged approach: manage the symptoms and prevent the complications.
You got it. But what if meds aren't enough to get the AFib under control?
Right, what then?
Well, there are other options. Sometimes we might recommend a procedure called cardioversion.
Cardioversion? That sounds kind of intense. What is it?
It involves delivering a controlled electrical shock to the heart to try to reset the rhythm back to normal.
Whoa, it's like hitting the reset button on the heart's electrical system.
Exactly. And it can be pretty effective, especially for folks with persistent AFib that isn't responding to meds. And we also have various catheter ablation techniques.
Catheter ablation. No, I've heard of that, but don't really know what it involves.
It basically uses heat or cold energy to destroy the abnormal tissue that's triggering the AFib.
Wow, so you go in there and zap those trouble spots.
Yep. And the good news is treatment options for AFib have really come a long way.
That's great to hear. Now, what about VTach? How do you approach treating that one?
Well, remember, VTach is more serious. It can be life-threatening, so we often have to act fast. Medications can help stabilize the heart rhythm, but sometimes we need more aggressive interventions.
I'm picturing someone coming into the ER with VTach. What happens then?
In an emergency like that, we'd probably use electrical cardioversion to shock the heart back to a normal rhythm.
Oh,
And depending on what's causing the VTach and the patient's overall health, we might recommend an implantable cardioverter defibrillator or ICD.
oh yeah, ICDs. They're like little guardian angels for the heart.
Right. It's a little device that constantly monitors the heart rhythm and can deliver a life-saving shock if it detects VTach or ventricular fibrillation.
So it's there just in case, ready to jump in and save the day. Pretty amazing. Okay, so we've talked about treatments for AFib and VTach. What about heart blocks? Is that where pacemakers really shine?
You bet. For the more serious heart blocks, especially second-degree type 2 and third-degree, a pacemaker is often the best solution.
Because it takes over the job of conducting those electrical signals, right?
Exactly. Keeps the heartbeat steady and prevents those dangerously slow heart rates.
It's fascinating how these little devices can make such a big difference.
It is. But even with all these awesome advancements in treatment, we can't forget about prevention.
Oh, right. The good old ounce of prevention.
Exactly. Maintaining a healthy weight, eating a balanced diet, exercising regularly, managing stress, all those things can have a huge impact on your heart health.
So it's about making healthy choices to protect your heart for the long haul.
Absolutely. And if you already have a heart condition, like high blood pressure or diabetes, managing it carefully is super important too.
Okay, so prevention is key.
Yeah,
But we also have some pretty amazing tools to treat these abnormalities when they do occur.
that's the good news. We've come a long way at understanding and managing these conditions.
All right, EKG enthusiasts, welcome back for the final round of our ECG deep dive. We've covered a lot of ground, but as with anything in medicine, I'm sure there's some twists and turns we haven't talked about yet.
Oh, absolutely. We've laid the groundwork, learned the basics, but the heart, well, it loves to throw us curveballs sometimes.
Curveballs, huh? Okay, I'm intrigued. What kind of curveballs are we talking about here?
Well, one thing that can be really surprising is that the severity of the symptoms doesn't always match up perfectly with how dramatic the ECG abnormality looks.
Really? So you could have an ECG that looks super alarming, but the person feels totally fine.
It happens. Take AFib, for instance. Some people with AFib don't have any symptoms at all. No palpitations, no shortness of breath, nothing.
Wow, that's wild. They could be walking around with AFib and not even know it.
Yep. It's like a secret they're carrying around. And then on the flip side, you can have folks with what looks like a relatively minor abnormality on the ECG, but their symptoms are really intense, really affecting their lives.
So it's not just about what you see on the tracing, it's about how the patient is actually experiencing it.
Exactly. That's why a good history and physical exam are so crucial. We need the whole picture, not just the electrical signals.
Okay, I'm starting to see how this gets really complex. Any other curveballs we should be aware of?
Well, another thing to keep in mind is that these abnormalities aren't always set in stone. They can change over time.
Change. You mean they can get better or worse?
Both, actually. And sometimes they can coexist.
So it's not just one abnormality, one diagnosis, end of story.
Not always. Someone might start with first-degree heart block, for example, and then it progresses to a more serious type over time. Or they could have AFib and a heart block at the same time, which can create a really complicated situation.
It sounds like we need to think of these ECGs like a story that's unfolding over time, not just a single snapshot.
That's a great way to put it.
Yeah.
And our job as clinicians is to read that story, understand the nuances, and adjust the treatment plan as needed.
Wow, I'm really starting to appreciate just how much goes into interpreting these ECGs. So as we wrap up our deep dive, what's the most important thing you want our listeners to remember? What's the key to becoming an ECG pro?
Well, I think the most important thing is to remember that ECG interpretation is both a science and an art. You need that solid foundation of knowledge, but you also need to be able to think critically, spot patterns, and see the big picture.
So it's not just about memorizing all the different squiggles and lines.
Right. It's about understanding what those squiggles and lines mean in the context of the patient's story, their history, their symptoms.
Got it. The ECG is just one piece of the puzzle.
Exactly. And don't underestimate the value of a good old-fashioned history and physical exam.
Right. Those are always the foundation. Well, this has been an incredible journey. Thank you so much for guiding us through the fascinating world of ECGs. I feel like I've learned so much.
My pleasure. And hey, remember, this is just the beginning of your ECG adventure. There's always more to learn, more to discover.
So true. Well, thanks for tuning in, everyone. And until next time, keep those hearts beating strong.
All right, so it looks like you're ready to deep dive into those 6 electrical detectives of the heart. The limb leads of an ECG.
Yes, the limb leads. Leads 1, 2, 3, AVR, AVL, and AVF. Such a fundamental part of cardiology.
They really are. I have to admit, though, sometimes I get a little lost in all those letters and numbers.
It's understandable, but trust me, once you grasp the concept of each lead, it's like having 6 different windows into the heart's electrical activity.
6 windows, huh? Okay, you've got my attention. But before we get to the specifics of each lead, let's make sure I understand the basics. What exactly are ECGs looking at?
Well, imagine the heart as a bustling city, right? With electrical signals constantly zipping around, keeping everything in sync.
Okay, I can picture that.
An ECG is essentially a map of that electrical activity. It allows us to visualize those signals and see how the heart is functioning.
So those squiggly lines we see on an ECG are actually a visual representation of the heart's electrical signals.
Precisely. And to capture those signals, we use electrodes placed on the skin. For the limb leads, we're talking about electrodes on the, well, limbs. The right arm, and left leg.
Makes sense.
Hmm.
But why do we need leads on different limbs? Couldn't we just use one electrode to pick up the heart's electrical activity?
That's a great question. Think of it like triangulating a signal. By measuring the electrical differences between these points, we can get a multidimensional view of the heart's electrical activity. It's not just about the strength of the signal, but also its direction.
Ah, so it's like having multiple cameras filming the same scene from different angles. Each camera gives you a slightly different perspective, and together they create a more complete picture.
Exactly. And that brings us to the two main types of limb leads, bipolar and unipolar.
Okay, now we're getting to the good stuff. What's the difference between these two types? I'll admit I get them mixed up sometimes.
It happens to the best of us. Imagine you have two microphones recording a conversation. Bipolar leads, like leads 1, 2, and 3, are like comparing the sounds picked up by both microphones. They measure the difference in electrical potential between 2 points.
So they're looking at the heart's electrical activity from two distinct points of view.
Right. Now, unipolar leads, our friends AVR, AVL, and AVF, are like focusing on just one microphone. They measure the electrical potential at one electrode, comparing it to a reference point created by averaging the other two electrodes.
Interesting. So unipolar leads are giving us a more focused perspective on the electrical activity coming from a specific limb.
Exactly.
Okay, that helps a lot. Now ready to tackle those leads one by one. Let's start with what you called the classic trio, leads 1, 2, and 3.
Yes. The OGs of ECG leads. Lead A is like comparing the signals from the right arm and left arm electrodes, giving us a horizontal view of the heart, almost as if we're looking at it from the side.
So lead is giving us a broad overview of the heart's electrical activity.
It is. It also plays a vital role in assessing the overall rhythm and those characteristic bumps and dips on an ECG, the P wave, QRS complex, and T wave.
Right, those bumps and dips. We've got to unpack those at some point for sure. But first, tell me about lead-2. You called it the MVP for rhythm analysis. Why is that?
Well, lead 2 measures the difference between the right arm and the left leg, giving us a more vertical view, almost like looking down at the heart from above.
Okay, I'm picturing it.
And because of this placement, lead 2 often provides the clearest view of the P wave.
And the P wave represents what exactly? Sorry, sometimes I need a quick refresher.
No problem at all. The P wave is the electrical signal that occurs right before the atria contract. Think of it as the conductor's baton, giving us the downbeat for each heartbeat.
Oh, that makes so much sense. So a clear P wave in lead-2 helps us see if the heart is beating regularly.
Exactly. Now, lead 3, it's like a supporting actor. It measures the difference between the left arm and left leg, offering a second vertical perspective.
Okay, so it basically confirms what we're seeing in lead-2. Provides a bit more context.
You got it. So together, leads 1, 2, and 3 work like a team to give us a well-rounded understanding of the heart's electrical activity. But we're not done yet. We've still got those augmented leads to explore.
Right. ABR, AVL, and AVF. You said there were like zoom lenses on our camera, each focusing on a specific part of the heart's electrical activity. I'm ready to hear more about these.
They really are. Remember those unipolar leads we talked about? Augmented leads are unipolar, and they provide a magnified view of the electrical activity coming from a specific limb.
So they're amplifying the signal from one limb to get a clearer picture.
Exactly. And that's why they're called augmented leads. They augment or magnify the signal. Now let's start with AVR. This lead focuses on the right arm.
So AVR is giving us a rightward view of the heart.
You could say that. It's often used to spot specific abnormalities, such as ischemic changes or shifts in the heart's electrical axis.
Ischemic changes.
Yeah.
That sounds serious.
It can be. Ischemia basically means there's a lack of blood flow to a part of the heart, which can lead to serious problems if not addressed. But AVR can help us detect those subtle changes early on.
Wow, so even though AVR might look a bit different from the other leads, it can reveal crucial information about the heart's health.
Absolutely. Now let's move on to AVL. This lead focuses on the left arm and gives us a clear look at the lateral wall of the left ventricle.
And the left ventricle is the heart's main pumping chamber, right?
That's right. It's the powerhouse of the heart, responsible for pumping oxygen-rich blood to the rest of the body. And AVL helps us assess the health of that critical part of the heart. It's particularly helpful in identifying issues like left ventricular hypertrophy.
Left ventricular hypertrophy. So that's when the left ventricle becomes abnormally thick.
Precisely. It can be a sign of underlying heart conditions like high blood pressure.
It's amazing how each of these augmented leads really is like a specialized lens, giving us a detailed look at a particular region of the heart. What about AVF? What's its specialty?
AVF focuses on the left leg's perspective, providing an inferior view of the heart as if we're looking up at it from below.
Ah, so if AVR is looking from the right and AVL is looking from the left, AVF is looking from the bottom.
Exactly. And this inferior view is crucial for detecting abnormalities in the inferior wall of the heart, such as an inferior myocardial infarction, which is basically a heart attack affecting the bottom portion of the heart.
Okay, so we've got our classic trio giving us a broad overview and our augmented trio providing more focused perspectives. But why is it so important to have all 6 of these leads working together? Why not just focus on the ones that seem most relevant to a particular situation?
Well, think of it like putting together a 3D puzzle of the heart's electrical system, right?
Mm.
Each lead provides a unique piece of information, and it's only by combining those pieces that we can get a truly comprehensive picture of what's going on.
So by combining the information from all 6 leads, we get a truly comprehensive picture of the heart's function.
Precisely. But it's not just about the leads themselves. It's about what those squiggly lines on the ECG are telling us. We need to analyze the different parts of the waveform: the P wave, QRS complex, and T wave.
So each of those little bumps and dips has a specific meaning. We can't just look at the overall shape of the waveform.
You're catching on quickly. Each component of the ECG waveform represents a different stage of the heart's electrical cycle. And by analyzing those components across all 6 leads, we can detect a wide range of heart conditions that might not be visible in just one lead.
Conditions like?
For example, arrhythmias. Those are irregular heartbeats, and they can range from harmless to life-threatening. The different leads can help pinpoint the type and severity of the arrhythmia, which in turn helps determine the right course of treatment.
So the ECG can help us determine if someone needs medication, a pacemaker, or even defibrillation.
Exactly. And it's not just about arrhythmias. The limb leads can also help us identify areas of the heart experiencing ischemia, like we talked about with AVR. This is crucial because ischemia can be a warning sign of potential heart attack.
This is incredible. I'm starting to see those squiggly lines. Less as squiggles and more as a secret code, a language that can reveal so much about the heart's health.
I love that analogy. It truly is a language. And the more we understand it, the better equipped we are to protect this vital organ.
Well said. This has been so helpful already. But I'm curious, if each lead provides a different view of the heart, what happens if one of those views is obscured or missing? How might that impact diagnosis?
That's a fantastic question, and one that we'll delve into right after this.
Okay, I can't wait. I'm already hooked on this ECG deep dive. Stay tuned, everyone. We'll be right back. Okay, so before we were talking about what happens if one of the leads isn't giving us a clear picture.
Right, if one of those views of the heart is obscured or missing.
Exactly.
Well, it definitely makes things a bit trickier, but it's not a complete roadblock.
So it's kind of like if one of the cameras in our analogy malfunctions, the other cameras can still capture enough of the scene.
Exactly. Plus, doctors don't just rely on the ECG alone, right?
Right. They consider the patient's medical history, their symptoms.
They might order additional tests, like an echocardiogram, to get a more complete picture.
Makes sense. But let's say one of those critical views is missing. For example, if AVF, which gives us that bottom-up perspective, isn't working correctly, wouldn't that make it harder to diagnose something like an inferior myocardial infarction?
You're right. It would definitely add a layer of complexity to the diagnosis. In that scenario, doctors would rely more heavily on the other leads, looking for any subtle clues that might suggest a problem in the inferior wall.
So it becomes a bit more like detective work.
Exactly. Piecing together the clues from the available evidence.
So experience and a deep understanding of ECG interpretation really come into play when one of those key leads is, well, out of commission.
Absolutely. Sometimes doctors might try repositioning the electrodes slightly to try and capture a stronger signal.
Oh, like adjusting the camera angle to get a better shot.
Precisely. Or they might integrate information from other tests, as we mentioned earlier.
It sounds like flexibility is key. Now, we've talked a lot about using the limb leads to diagnose heart conditions, but I'm also curious about how they actually guide treatment.
That's where things get really interesting. The limb leads can tell us a lot about not just what's wrong, but also how to best address the problem.
So they're not just diagnostic tools, but also guides for treatment.
Exactly. Let's take arrhythmias, for example. Depending on the type and severity, they can be pretty serious.
Definitely. And there's so many different kinds.
Right. And each type might require a different approach. For some, medication might be enough to regulate the heart rhythm. But for more serious arrhythmias, you might need a pacemaker or even defibrillation.
Wow, so the stakes can be pretty high.
They can, but that's why those limb leads are so crucial. By carefully analyzing those ECG patterns, those peaks and valleys, doctors can pinpoint exactly which type of arrhythmia the patient is experiencing.
So the ECG isn't just a snapshot of the heart's electrical activity, it's actually a roadmap that guides doctors towards the most effective treatment.
Precisely. And that goes beyond arrhythmias, too. ECGs can help direct treatment for things like ischemia and myocardial infarction, providing vital information about the location and extent of damage to the heart muscle.
It's remarkable. It's like they reveal not just what's going on, but how to best step in and help.
It's like having a conversation with the heart, using the ECG as our interpreter.
I love that. We're listening to its rhythm, its strength, its struggles.
And then using that knowledge to provide the most appropriate care.
This whole deep dive has been eye-opening. I used to be intimidated by those squiggly lines.
No, I remember those days.
But now I'm starting to see them as a powerful language. A language that can guide us toward better heart health.
That's what it's all about, unraveling those mysteries, finding those patterns, and ultimately improving people's lives.
Speaking of unraveling mysteries, I'm curious to learn about the future of ECGs. It seems like we've come a long way in understanding the heart's electrical language. But are there any new advancements on the horizon? Anything that could make these diagnoses even more accurate or accessible?
Absolutely. The world of ECG technology is constantly evolving. One really exciting area is wearable ECG technology.
Wearable, like on our wrists.
Exactly. Imagine smartwatches or fitness trackers that can monitor your heart rhythm continuously.
Instead of those bulky ECG machines in the doctor's office, that sounds like something straight out of a sci-fi movie.
It does, doesn't it? But it's becoming a reality. This kind of technology could completely change how we detect and manage heart conditions, especially arrhythmias.
Imagine being able to identify an irregular heartbeat as it happens.
And getting immediate medical attention if needed. It could be life-saving.
Are there any other innovations in the works that you're particularly excited about?
Another fascinating area is the development of artificial intelligence or AI algorithms for ECG interpretation.
AI reading ECGs. So we're talking about algorithms that can analyze those complex electrical patterns and identify abnormalities.
Precisely. And they're doing it with incredible accuracy. Of course, it's not about replacing doctors.
Right. It's about giving them an additional tool to help with diagnosis and treatment.
Exactly. AI can help identify subtle patterns that even the most experienced cardiologist might miss.
It's amazing to think how technology is transforming the field of cardiology.
It really is. It seems like there's a real push towards making these diagnostic tools more powerful, more accessible, and more personalized.
All with the goal of improving heart health and ultimately saving lives.
Couldn't have said it better myself.
Well, I have to say, I started this deep dive feeling a little intimidated by all those squiggly lines,
We've all been there.
but now I feel empowered. Like I've gained a deeper understanding of this incredible organ.
That's wonderful to hear. Knowledge is power, especially when it comes to your health.
And understanding those 6 limb leads is like having a key to unlock the secrets of your own heart.
Well said. I want to thank you for having me today. It's always a pleasure to talk about this fascinating subject.
The pleasure was all mine. And to our listeners, thanks for joining us on this incredible deep dive into the world of ECGs. We hope you learned something new today.
And remember, if you have any concerns about your heart health, don't hesitate to talk to your doctor.
Until next time, stay curious, everyone, and keep exploring.
See you on the next deep dive.
So we were talking about the future of ECGs, and you mentioned wearable ECG technology.
Yeah, the idea of continuously monitoring your heart rhythm right from your wrist.
It's pretty mind-blowing. Like something out of a sci-fi movie. Instead of those big clunky machines at the doctor's office.
Exactly. It really could revolutionize how we detect and manage heart conditions, especially arrhythmias.
Especially arrhythmias. Imagine being able to identify an irregular heartbeat as it happens, getting immediate medical attention.
It could be life-saving.
It really could. Are there any other innovations you're excited about? Besides the wearables,
Well, there's been a lot of buzz around artificial intelligence.
AI. for reading ECGs.
Yeah, AI algorithms that can analyze those complex electrical patterns.
And identify abnormalities, potentially.
Exactly. They're already achieving some pretty impressive levels of accuracy.
So it's like having a second pair of eyes, an extra layer of analysis.
Right. It's not about replacing doctors, of course, more like giving them an additional tool.
A tool to assist with diagnosis and treatment.
Absolutely. Because sometimes AI can pick up on really subtle patterns.
Patterns that even the most experienced cardiologist might miss.
Right. And those subtle patterns could be really important clues.
It's amazing to think how technology is transforming cardiology, making these diagnostic tools more powerful, more accessible.
And more personalized.
It's all pretty incredible.
It is.
You know, I started this deep dive feeling intimidated by those squiggly lines, all those peaks and valleys.
I understand. It can seem overwhelming at first.
But now I feel like I've gained a deeper understanding of this incredible organ and the language it speaks.
That's fantastic to hear.
It really is. Understanding those 6-limb leads, it's like having a key to unlock the secrets of the heart.
Well said. And remember, knowledge is power.
Especially when it comes to our health.
Absolutely. So never stop learning and never be afraid to ask questions.
Great advice. Well, I want to thank you for joining us today, for sharing your expertise and passion for ECGs. It's been truly enlightening.
It's been my pleasure. I always enjoy talking about cardiology.
And to our listeners, thank you for joining us on this deep dive into the world of ECGs. We hope you found it informative and engaging.
And if you have any concerns about your heart health, please talk to your doctor.
They're your best resource for personalized advice and care.
Absolutely. Until next time, stay curious.
And keep exploring.
Welcome to the Deep Dive. Today, we're going on a journey.
To the center of your chest.
That's right. We're going to be exploring those electrical secrets of your heart.
Yeah, those electrical secrets.
We've got a whole stack of research articles all about ECGs.
No.
Those wiggly lines that doctors use.
Yeah, to understand.
Turn on with your ticket.
And we're going to focus on a specific part of the ECG called the precordial leads.
Okay.
They're like this special set of lenses
Okay.
that give us a close-up view of your heart's electrical activity.
Okay, so before we get too deep into the weeds, can you remind me what an ECG actually measures?
Sure.
I know it has something to do with electricity,
Yeah, it's all about electricity.
but how does that translate to understanding my heartbeat?
So your heart beats because of these tiny little electrical impulses
Okay.
that travel through it in a very specific pattern.
Okay.
And an ECG, or an electrocardiogram, picks up these electrical signals through electrodes that are placed on your skin.
Yeah.
And these signals are then amplified and recorded on a graph.
Got it.
And this gives doctors this visual representation of your heart's electrical activity.
Okay, so these precordial leads, are they like extra sensitive electrodes or something?
They are electrodes,
Okay.
but they're specifically placed on your chest
Okay.
to give us a detailed view of the ventricles,
Okay.
which are the main pumping chambers of your heart.
Ah, the ventricles. Those are the powerhouses of the heart.
Yeah, they are.
So how many of these precordial leads are there?
6.
Okay.
They're labeled V1 through V6.
Makes sense.
Each lead gives us a slightly different angle
Okay.
on the ventricle's electrical activity.
Got it.
Like if you were looking at a building from different sides,
Okay, yeah.
you get a more complete picture by combining all the views.
I like that analogy. That makes sense.
Yeah.
So let's start with V1.
Okay.
Where is V1 placed, and what kind of information does it actually give us?
V1 is placed on the right side of your chest
Okay.
in the fourth intercostal space, which is basically the space between your fourth and fifth ribs, just to the right of your breastbone.
Okay, got it. So what's so special about that spot?
So V1 is really good at picking up signals from the right ventricle.
Okay.
It's especially useful for detecting something called a bundle branch block.
A bundle branch block? That sounds kind of serious.
It can be.
What is that?
So imagine the electrical signals in your heart
Okay.
as a network of roads.
Okay.
The bundle branches are like major highways
Uh-huh.
that carry these signals to the ventricles,
Okay.
telling them when to contract.
Got it.
A bundle branch block is like a road closure on one of these highways,
Oh.
disrupting that flow of electrical signals.
So if V1 shows signs of a bundle branch block, then what does that mean for the patient?
Well, it really depends
Okay.
on the type and severity of the block.
Okay.
Some bundle branch blocks are totally harmless,
Okay.
while others can cause problems with the heart's rhythm,
Oh.
leading to palpitations or even faint.
So it could be a range of things.
Yeah.
Okay. So it's important to catch them early.
Yes, early detection is key.
Wow. So V1, it's like a traffic camera alerting us to potential roadblocks in our heart's electrical system.
Exactly.
That's pretty cool.
Yeah.
All right, let's move on to V2.
All right.
Where is this lead placed, and how does its view differ from V1's?
V2 is placed right next to V1,
Okay.
but on the left side of your chest,
Okay.
still in that fourth intercostal space.
All right.
So while V1 focuses mainly on the right ventricle,
Okay.
V2 gives us a combined view
Okay.
of both the right ventricle and the septal wall.
The septal wall, isn't that the wall that divides the heart into lefty right sides?
That's exactly right.
Okay.
It's a very crucial structure.
Yeah.
And V2 helps us detect any problems
Sure.
that might be affecting it.
So what kind of problems can occur with the septal wall?
One serious condition is a septal infarction,
Okay.
which is essentially a heart attack that affects the septal wall itself, damaging the muscle and potentially disrupting the heart's electrical pathways.
Oh, wow.
And V2 can show specific changes that help doctors diagnose this condition quickly.
So V2 is keeping an eye on both the right ventricle and that critical dividing wall.
That's right.
It sounds like these leads are working together to give doctors a really detailed understanding of what's going on.
They are. It's a team effort.
Now I'm curious about V3.
Okay.
Where does this one go?
V3 is placed in the fifth intercostal space, halfway between V2 and V4.
Okay, so we're shifting down a bit and moving more toward the center of the chest.
Exactly.
What is V3 focusing on?
So V3 gives us a transition view.
Okay.
Bridging the information from V2 and V4, it's still picking up signals from the right ventricle and the septal wall.
Okay.
But it's starting to give us more information about the anterior wall of the left ventricle.
The anterior wall, is that just a fancy way of saying the front wall
Exactly.
of the left ventricle?
Yes, the left ventricle is especially important because it's the main pumping chamber,
Oh, wow.
responsible for sending oxygen-rich blood to your entire body.
So V3 is starting to give us a glimpse of this crucial pumping chamber.
Yes, it is.
That brings us to V4.
All right.
Where does this lead sit and what's its specialty?
So V4 is placed right over the left ventricle
Okay.
in the fifth intercostal space at the midclavicular line. That's basically a line that runs straight down from the middle of your clavicle
Okay.
or your collarbone.
Okay, so if V3 was giving us a sneak peek of the left ventricle, then V4 is giving us the full view, right?
You could say that V4 is our go-to lead for assessing the anterior wall of the left ventricle.
Right.
It's particularly sensitive to any changes in that area,
Okay.
which makes it really important for detecting a condition called an anterior myocardial infarction.
Okay, hold on. Anterior myocardial infarction, that's a mouthful.
Yeah, it is.
Can we break that down for our listeners?
Of course.
What is that?
Myocardial infarction is the medical term for a heart attack. It happens when blood flow to a part of the heart muscle is blocked,
Okay.
usually by a blood clot.
Uh-huh.
And anterior simply refers to the front side.
It's the front.
So an anterior myocardial infarction means a heart attack,
Okay.
affecting the front wall of the heart.
So V4 is like a security camera pointed right at the front of the left ventricle looking for any signs of trouble.
Exactly.
That was pretty amazing. Now I'm starting to see how all of these leads work together like a team,
Yeah.
each providing a unique piece of the puzzle.
Absolutely.
What about V5? What does this one fit in?
V5 is placed next to V4,
Okay.
but it's shifted slightly outward toward your side
Okay.
at a point called the anterior axillary line.
Okay.
Imagine a line running straight down from your armpit.
Okay.
That's the anterior axillary line.
Okay, so we're moving from the center of the chest out towards the side?
Yes.
What kind of view does V5 give us?
So V5 shifts our focus to the lateral wall of the left ventricle. Lateral means side. So we're now looking at the side of that main pumping chamber.
Okay.
This lead is especially helpful in detecting a lateral myocardial infarction,
Okay.
which is a heart attack affecting the side wall of the heart.
So V4 is watching the front, and V5 is keeping an eye on the side. It's like having a surveillance system for your heart.
Exactly.
Now, we only have one lid left, V6.
All right.
Where is this final lead placed, and what does it tell us?
V6 is placed right below V5,
Okay.
still on that anterior axillary line,
Okay.
but it's even further out towards your side at a point called the mid-axillary line.
Got it.
Yeah.
Okay, so we're really getting a side view now.
Yes.
What is V6 focusing on?
V6 gives us a look at both the lateral and posterior walls
Okay.
of the left ventricle. Posterior means back.
Okay.
So we're now seeing the side and back of that main pumping chamber.
Got it.
This lid is particularly useful for detecting a posterior myocardial infarction,
Okay.
which is a heart attack affecting the back wall of the heart.
Wow, so we've gone from the front to the side to the back.
We've covered it all.
With all 6 leads, we're really covering all the bases, aren't we?
Exactly. Each lead provides a unique perspective, and when you put them all together,
Yeah.
you get a comprehensive view
Okay.
of the left ventricle's electrical activity.
This is making me wonder, why do we need so many different views of the left ventricle?
Yeah.
Wouldn't 1 or 2 leads be enough?
It's all about getting the most accurate information possible.
Okay.
The heart is a three-dimensional organ, and electrical signals can travel in very complex patterns. By looking at the heart from different angles,
Okay.
we can get a much clearer picture of what's happening.
I see.
Think of it like trying to understand the shape of a mountain.
Okay.
If you only look at it from one side, you might think it's a simple cone.
Yeah.
But if you walk around it and see it from all different angles, you realize it's much more complex,
Right.
with ridges and valleys and hidden features.
It's a great analogy. So these precordial leads are like our hiking boots, allowing us to explore the heart's electrical landscape from all sides.
Exactly.
But all this talk about myocardial infarctions is making me a bit nervous.
Understandably.
Are there any other conditions that these leads can help us detect?
Of course.
Maybe something a little less, well, life-threatening?
Yes, definitely. The precordial leads can also reveal information about other conditions like left ventricular hypertrophy.
Left ventricular hypertrophy, break that down for me.
Okay, so hypertrophy means enlargement.
Okay.
So left ventricular hypertrophy is a condition where the muscle wall of the left ventricle becomes thickened.
Okay.
It's often caused by high blood pressure,
Okay.
but it can also be a sign of other underlying heart conditions.
So a thicker heart muscle, is that a good thing or a bad thing?
It can be both.
Really?
Sometimes a slightly thicker heart muscle
Okay.
is a normal adaptation to exercise
Okay.
or other demands on the heart.
Okay.
But if the thickening is excessive or caused by an underlying medical condition, it can actually weaken the heart over time,
Oh, wow.
making it less efficient at pumping blood.
So how do the precordial leads help us understand left ventricular hypertrophy?
The precordial leads can show specific changes in the electrical signals
Okay.
that suggest left ventricular hypertrophy.
Okay.
These changes might be subtle, but to a trained eye, they can be very telling.
Okay.
Early detection is key
Yeah.
because it allows doctors to address the underlying cause,
Right.
whether it's high blood pressure or a valve problem or something else.
So these leads aren't just about detecting problems, they're also about understanding the heart's overall health
Yes,
and identifying potential issues before they become serious.
exactly. It's like having a personal trainer for your heart.
That's a great way to put it. The precordial leads give us a window into the heart's inner workings,
They do?
allowing us to monitor its health, diagnose problems, and guide treatment decisions.
That's right.
This has been incredibly insightful. We've gone from like the basic placement of the leads to understanding how they reveal a whole range of information about the heart.
Yeah.
But I have to ask, are there any limitations to these leads?
That's a good question.
Like, are there times when they might not give us the full picture?
That's a great question.
Go ahead.
While the precordial leads are incredibly valuable, they're not foolproof.
Okay.
There are certain conditions that might be difficult to detect using only the precordial leads.
Okay.
For example, some heart rhythm abnormalities might not be obvious in the precordial leads
Okay.
and might require additional testing.
So it's important to remember that the ECG is just one tool in the doctor's toolbox.
Exactly. Doctors use a combination of information.
Right.
Your medical history, your
Right.
physical exam, your symptoms, and other tests to make a diagnosis.
Okay.
The ECG, including the precordial leads,
Mm-hmm.
is a crucial piece of the puzzle, but it's not the only piece.
This is reminding me of those crime dramas where they use fingerprints and DNA evidence to solve a case. The ECG is like the fingerprint of the heart, providing unique clues about its activity.
I like that that's a great way to think about it. Each person's ECG is unique,
Yeah.
and the precordial leads help us decipher those individual patterns
Right.
to understand what's happening with their heart.
Okay, so we've explored the individual roles of each precordial lead.
Yes.
And we've seen how they work together to give us a comprehensive view of the heart's electrical activity.
Right.
We've also talked about some of the conditions they can help diagnose, from heart attacks to left ventricular hypertrophy.
Exactly.
But I'm wondering, are there any situations where these leads might give us false readings?
That's a really important point to bring up.
Okay.
While the precordial leads are generally reliable,
Okay.
there are a few factors
Okay.
that can sometimes affect the readings.
Right.
For instance, the placement of the electrodes is crucial.
Uh-huh.
If the electrodes are positioned incorrectly, it can skew the results.
So it's all about precision when it comes to placing those leads.
Exactly. Even a slight misplacement can alter the electrical signals,
Right.
picked up by the leads, potentially leading to misinterpretations.
What about other factors? Can anything else interfere with the readings?
Movement is another potential culprit.
Oh, really?
If the patient is moving around during the ECG,
Mm-hmm.
it can create artifacts on the tracing,
Okay.
those little blips and squiggles that aren't actually coming from the heart.
So it's important to stay still during an ECG.
Yes, very important.
That makes sense. Are there any other things that can throw off the readings?
Certain medical conditions
Oh,
can also affect the ECG results.
Uh-huh.
For instance, electrolyte imbalances like low potassium or magnesium levels
Okay.
can cause changes in the heart's electrical activity that might be misinterpreted.
Wow. So it's a complex interplay of factors that contribute to an accurate ECG reading.
It is.
It seems like interpreting these leads requires a lot of expertise.
It does. You're absolutely right. That's why it's so important to have a trained healthcare professional analyze the ECG results. They have the knowledge and experience to consider all the variables
Yeah.
and make an accurate diagnosis.
Okay, so we've covered the importance of precise electrode placement, staying still during the ECG, and considering potential medical factors that can affect the readings.
Right.
But let's shift gears a bit and talk about the benefits of understanding these precordial leads.
Okay.
We've discussed how they can help diagnose problems,
Yeah.
but can they also provide reassurance when things are working as they should be?
Absolutely. In
Right.
fact, a normal ECG can be incredibly reassuring.
Really?
Seeing those perfectly formed waves and intervals can confirm that your heart's electrical system is functioning properly.
So it's like getting a clean bill of health
Yeah.
for your heart's electrical system.
Exactly.
That's great to hear.
Yeah, normal ECG can be really reassuring, especially if you've been having any anxieties
Right.
about your heart health. It's like a weight lifted off your shoulders, knowing that your heart is beating in a healthy rhythm.
Yeah, that's definitely a relief to hear. So it's not always about finding problems.
Right.
Sometimes it's about confirming that everything is working as it should be.
Exactly.
Okay, now thinking back to all the different leads that we've talked about, it's clear that they play such a crucial role in understanding the heart's electrical activity.
Yeah.
But what does this all mean for our listeners who might not be medical professionals?
Right.
Why should they care about these precordial leads?
Well, understanding even the basics of your heart's electrical system can make you a more informed advocate for your own health.
Oh.
For example, if you're experiencing any chest pain or palpitations, you can better communicate your symptoms to your doctor.
Okay.
You can explain that you understand the importance of an ECG, especially the precordial leads in assessing heart health.
So it's about empowering yourself with knowledge,
Exactly.
being able to ask the right questions and understanding the information that your doctor is giving you.
That's right. The more you know about your body, the better equipped you are to make informed decisions about your health.
This is making me think about how we often take our hearts for granted.
Yeah.
It's this incredible organ constantly working behind the scenes.
It really is.
We rarely give it a second thought until something goes wrong.
That's true. We often neglect the importance of our cardiovascular health
Yeah.
until we're faced with a problem.
Yeah.
But understanding the heart's electrical system, including the role of the precordial leads, can help us appreciate just how intricate and vital this organ truly is. It might even inspire us to take better care of it.
Yeah, I think you're right. Learning about these leads has definitely given me a newfound respect for my heart. It's like I've been given a glimpse behind the curtain, and I'm amazed by the complexity and precision of its electrical system.
It is an amazing system, and it's one worth protecting simple lifestyle choices.
Oh, okay.
Like eating a healthy diet, exercising regularly, and managing stress can go a long way in keeping your heart healthy.
Right.
And those electrical signals flowing smoothly.
So, as we wrap up this deep dive into the world of precordial leads, let me leave our listeners with a final thought.
Okay.
We've focused on the electrical aspect of the heart, but it's important to remember that this is just one facet of this incredible organ.
Yeah.
The heart is also a symbol of life, love, and resilience.
Absolutely.
Take a moment to appreciate its steady beat, the rhythm that keeps you going every single day.
And if this deep dive has sparked your curiosity, remember, there's a world of knowledge out there waiting to be discovered. Keep exploring, keep learning, and keep that heart healthy.
That's a wrap on this episode of The Deep Dive. Until next time, stay curious. All right, get ready, because we're going to take a deep dive into ECGs today.
Ooh, sounds exciting.
It is. I know you want to get a good handle on how those squiggles on the screen,
Yeah.
translate to what's happening with the heart's electrical activity.
For sure.
So we're going beyond just memorizing PQRST waves
Right.
and really understanding like what makes those lines do what they do.
Yeah.
Jump and dip. It's like we're heart detectives uncovering those electrical secrets that keep us ticking.
I love that analogy. And you're right, it's far more captivating than just memorizing stuff.
Right.
ECGs are really like a window into this complex electrical dance happening in your heart.
Yeah.
And the key to deciphering it all really lies in understanding two key processes:
Okay.
depolarization and repolarization.
See, this is what I'm talking about.
Yeah.
Depolarization, repolarization.
Yeah,
Those words sound a bit intimidating at first.
they do.
But you're saying they're like the master keys to unlocking the ECG code. Okay, so let's start there. What's fascinating is that the heart doesn't need our brain to tell it to beat.
Right.
It's got its own built-in power grid, right?
Absolutely. The heart has its own electrical system,
Wow.
totally independent of the brain.
Okay.
And the conductor of this orchestra is the SA node,
Okay.
the heart's natural pacemaker.
So the SA node is like the heart's tiny DJ, setting the rhythm for the whole party.
Precisely.
Hmm.
It sends out electrical impulses that spread through the heart, prompting the muscle to contract and pump blood.
Okay, that makes sense. But here's where I get a little lost. It's not just electricity flowing through wires, is it? Like in our house.
Yeah,
There's something about like ions being involved.
you got it. It's a great question. And you're right, it's not like a simple electrical circuit.
Okay.
Think of it this way. You know how batteries use chemical reactions to create electricity?
Yeah.
Well, your heart cells do something very similar, using ions, sodium, potassium, and calcium that move across cell membranes.
So each heart cell is like its own tiny battery. That's crazy.
It is pretty wild.
But how does that actually make the heart beat?
Imagine a wave going across a stadium.
Okay.
That's kind of what happens during depolarization.
Wait, depolarization, is that the on switch for the heart muscle cells?
Exactly. It's the electrical activation of those cells,
Okay.
causing them to contract. When the SA node sends its signal,
Yeah.
it triggers a rapid influx of these ions into the heart muscle cells,
Okay.
changing their electrical charge. This change, this depolarization, spreads from cell to cell,
Huh.
creating that wave-like motion you mentioned, ultimately causing the heart muscle to squeeze.
So it's like a chain reaction.
Yes.
One cell depolarizes, triggering the next, and so on.
Precisely. And all this coordinated electrical activity
Yeah.
is what generates the force needed to pump blood throughout your body.
Okay.
And of course, it's what creates those characteristic spikes and dips on an ECG.
Right.
The P wave and the QRS complex, for example,
Yeah.
directly reflect this depolarization process.
Okay, so if depolarization is the on switch, making the heart contract, what happens next? Does the heart just stay contracted?
That's a great point.
That doesn't seem very efficient.
No, not at all. After the contraction,
Yeah.
the heart needs to relax and reset, preparing for the next beat. That's where repolarization comes in.
Okay.
It's like stretching after a workout.
Yeah.
Your muscles need to relax before they can effectively work again.
Repolarization is like the heart muscle taking a deep breath and getting ready for the next round.
Exactly. During repolarization, those ions that rushed into the cells during depolarization are pumped back out,
Okay.
restoring that electrical balance. This process is represented by the T wave on the ECG.
So if I'm getting this right, we've got depolarization causing the heart muscle to contract,
Yes.
and then repolarization allowing it to relax. And the
Right.
ECG is like a visual timeline of this whole electrical dance.
You got it.
Yeah.
But here's where it gets even more intriguing. The shape, size, and timing of these waves.
Mhm.
The P wave, QRS complex, and T wave can reveal a whole lot about the heart's health.
Really?
Even slight deviations can be like red flags signaling potential problems.
So it's not just about seeing the waves, it's about understanding what they're telling us.
Exactly.
Like a messed up T wave could be a sign of trouble.
Exactly. For example, a flattened or inverted T wave
Yeah.
might indicate that a part of the heart muscle isn't getting enough blood flow,
Oh, wow.
a condition called ischemia.
Okay, now that's really interesting. So those seemingly simple waves can reveal some pretty serious stuff.
Yes.
But how does a lack of blood flow mess with the T wave? What's happening at a cellular level?
That's a fantastic question, and it takes us deeper into the intricate world of ion channels and cell physiology.
Okay.
Essentially, when the heart muscle is starved of oxygen,
Yeah.
it disrupts the delicate balance of ions across cell membranes,
Mm.
specifically during repolarization. This disruption alters the electrical activity.
And that shows up as a wonky T wave on the ECG. Wow, this is like piecing together a puzzle. We're seeing how changes at the cellular level can have big implications for the electrical activity of the entire heart,
Absolutely.
and how those changes are reflected in the ECG. I'm starting to see why understanding depolarization and repolarization is so crucial.
Yeah.
It's not just about recognizing waves, it's about understanding what those waves tell us about the heart's health.
Exactly. And that's what makes ECG interpretation such a powerful tool in cardiology.
Yeah.
It allows us to peer into the heart's electrical activity and detect problems that might not be apparent otherwise.
This is blowing my mind. I feel like we've only just scratched the surface here. I'm
Well,
already hooked.
we've got plenty more to explore.
Okay.
So are you ready to dive deeper into the world of ECG abnormalities?
Oh, yeah.
What they reveal about the heart's electrical secrets?
Absolutely. Let's keep going. All right. So we've established that even tiny hiccups in depolarization or repolarization
Right.
can show up on the ECG like that wonky T wave we talked
Yep.
about. But let's get specific. What are some other ways the heart's electrical system can go haywire?
Okay.
And how would we see that on an ECG?
Well, imagine the SA node, our heart's DJ, suddenly decides to play double time. Or, conversely, slows the beat down to a crawl.
Okay, so like a heart racing out of control, or on the flip side,
Yeah.
beating way too slow. Those must have names, right?
Exactly. We call a heart rate that's too fast tachycardia,
Okay.
and a heart rate that's too slow bradycardia.
Tachycardia, bradycardia.
Yeah.
Got it.
Both can be red flags
Yeah.
and would be pretty obvious on an ECG just by looking at the spacing between the heartbeats.
So if the heartbeats are crammed together, it's tachycardia.
Uh-huh.
And if they're spaced way out, it's bradycardia.
Right.
But those seem almost too straightforward. Are there any trickier electrical malfunctions that might not be so obvious?
Oh, absolutely. Things can get much more complex.
Yeah.
Imagine instead of a smooth rhythm,
Yeah.
the electrical signals start firing off randomly in the ventricles.
Okay, so not just a consistent fast or slow beat, but more like a chaotic electrical storm in the heart.
A very apt description. That's ventricular fibrillation.
Okay.
And it's a life-threatening situation
Mm.
because the heart's no longer pumping blood effectively.
Mm.
On an ECG, it looks completely erratic.
Really?
No recognizable P waves, QRS complexes, or T waves. Just a jumbled mess.
Wow, so the ECG really is a life-saving tool. Doctors can actually see this electrical chaos happening in real time and intervene.
Precisely. That's why ECGs are crucial in emergency situations.
Yeah.
They help healthcare professionals quickly identify these dangerous arrhythmias and take immediate action.
I'm seeing a whole new level of appreciation for these squiggly lines, but it makes me wonder if the heart has its own electrical system.
Yeah.
Why can things like stress or caffeine make my heart race? Doesn't that mean my brain is somehow influencing it?
Excellent question. Well, the heart is electrically independent.
Okay.
It's still part of the body and influenced by various factors,
Yeah.
including hormones released during stress and, yes, even caffeine. Think of it like this. The heart has its own internal rhythm, but it's also listening to what's happening in the rest of the body.
So even though the heart is calling its own shots, it's still part of the whole system.
Exactly. For instance, when you're stressed,
Yeah.
your body releases adrenaline.
Yeah.
Adrenaline acts on the heart,
Okay.
increasing the heart rate and the force of contraction.
Okay.
So while your brain isn't directly sending electrical signals to the heart,
All right.
it's influencing it through these chemical messengers.
Okay, so it's more of an indirect influence. That makes sense. It's like the heart is constantly adjusting and adapting
Right.
to maintain its balance in response to what's happening in the body.
That's a great way to put it. And that adaptability is part of what makes the heart so remarkable.
This is all fascinating, but I have to admit, my brain is feeling a little full.
I hear you.
We've covered so much ground, from those tiny ion batteries to life-threatening arrhythmias.
We have.
Is there anything crucial we've missed before we move on?
Well, there's one more piece of the puzzle we should touch on.
Yeah.
Contractility. We've talked about the heart's rhythm, with the when of the heartbeat.
Yeah.
But what about the how hard?
Hold on. So you're saying there's more to the heart's pumping power than just those electrical signals?
Absolutely.
Right.
Contractility refers to the inherent ability of the heart muscle to contract forcefully.
Oh.
It's the difference between tapping your finger and making a fist.
Okay.
Both involve muscle contraction, but the force and intensity are different.
Okay, I'm starting to see the distinction. So the electrical signal tells the heart when to beat,
Yeah,
and contractility determines how hard it squeezes.
precisely. And just like those electrical signals can be disrupted,
Yeah.
Contractility can also be affected by various factors,
Okay.
including heart disease, certain medications, and even exercise.
Whoa, so there's a whole other level of complexity beyond the electrical system.
Mm-hmm.
What determines this contractility then?
Right?
Is it also about ions moving around?
It's a bit more complex than that.
Okay.
While calcium plays a crucial role,
Yeah.
contractility is also influenced by things like the stretching of the heart muscle fibers and the action of certain hormones.
Mm-hmm.
For example, when you exercise,
Uh-huh.
your heart muscle stretches more,
Okay.
leading to a more forceful contraction.
So it's like a finely tuned orchestra.
Yes.
The electrical system sets the tempo,
Right.
but the contractility of the heart muscle determines the volume and intensity of the music.
A perfect analogy.
Yeah.
And just as a conductor can adjust the volume and dynamics of an orchestra,
Yeah.
the heart can adjust its contractility to meet the body's demands.
This is incredible. I had no idea the heart was capable of such intricate adjustments. But it also makes me realize how much we still haven't covered. Like, how does the heart know when to increase or decrease contractility? Are there sensors in the body that tell it what's going on?
That's a fantastic question.
Yeah.
And it takes us into the realm of the autonomic nervous system and baroreceptors,
Yeah.
specialized sensors that monitor blood pressure. These sensors constantly send information to the brain, which then fine-tunes the heart's contractility to maintain stable blood pressure.
So it's like a feedback loop. The heart pumps sensors, monitor the pressure.
Right.
The brain receives the information and makes adjustments, and the heart responds accordingly.
Exactly. And this intricate interplay between the heart, the nervous system,
Yeah.
and hormonal influences ensures that blood flow is constantly adjusted to meet the body's ever-changing needs.
This deep dive is truly living up to its name.
It is.
I feel like we've only just begun to explore the vast complexities of the heart. Are we ready to wrap things up, or are there more layers to this onion we need to peel back?
Well, we've covered a lot of ground,
Hmm.
from the basics of depolarization and repolarization
Right.
to the nuances of contractility.
Yeah.
But before we conclude our exploration,
Okay.
there's one final question that's often on people's minds.
Right.
Can external factors beyond stress and caffeine actually damage the heart's electrical system?
Now, that's a question I'm definitely curious about. We've talked about how stress and caffeine can influence the heart's rhythm, but can they actually cause lasting harm?
Yeah.
And what about other things like alcohol or even certain medications? Could those mess with the heart's electrical system?
Those are excellent questions, and they highlight the delicate balance
Yeah.
between our lifestyle choices and our heart health.
Uh,
While the heart is remarkably resilient, it's not invincible. Certain substances and habits can indeed disrupt its electrical system,
Really?
sometimes leading to serious consequences.
Okay, now I'm really intrigued. Can you give us some specific examples? Like, how does alcohol affect the heart's electrical activity? And
Right.
what about medications? Are there certain drugs that can interfere with depolarization or repolarization?
Mhm. Let's start with alcohol. While moderate alcohol consumption might not pose a significant risk for most healthy individuals,
Okay.
excessive alcohol intake can have detrimental effects on the heart's electrical system.
So those weekend binges might not be as harmless as some people think.
Unfortunately, that's correct. Heavy drinking can disrupt the normal rhythm of the heart,
Oh, wow.
leading to a condition known as holiday heart syndrome.
Holiday heart syndrome. That sounds almost festive,
It does.
but I have a feeling it's anything but.
You're right. It's a bit of a misnomer. It typically occurs after periods of heavy alcohol consumption, often during holidays or weekends, hence the name. It's characterized by an irregular heartbeat,
Okay.
specifically atrial fibrillation, where the atria quiver instead of contracting effectively.
So it's like the heart's DJ has had a few too many drinks and can't keep the beat steady.
A very colorful way to put it.
Yeah.
And while these episodes of atrial fibrillation often resolve on their own once the alcohol is out of the system, repeated episodes can weaken the heart muscle
Really?
and increase the risk of more serious complications down the line.
So moderation is key, as with most things in life. What about medications? Can those also mess with the heart's electrical system?
Absolutely.
Yeah.
Certain medications,
Yeah?
while beneficial for treating other conditions,
Right.
can have unintended consequences for the heart's electrical activity.
Are we talking about specific heart medications?
Yeah.
Or can even common drugs like painkillers have an impact?
It can be both.
Yeah.
For example, some antiarrhythmic drugs designed to regulate heart rhythm
Yeah.
can ironically trigger other types of arrhythmias in certain individuals.
Oh.
And even over-the-counter medications like certain decongestants and antihistamines can affect heart rate and rhythm,
Really?
especially in people with pre-existing heart conditions.
Wow, so it's important to be aware of potential interactions and
Yes.
to consult with the doctor before taking any new medications, even those available over the counter?
Precisely.
Yeah.
It's also crucial to be honest with your healthcare provider about your lifestyle habits,
Okay.
including alcohol consumption, caffeine intake,
Yeah.
and any recreational drug use, as
Wow.
these can all influence how medications affect your heart.
This is incredibly valuable information. It's a reminder that the heart is a complex and delicate organ,
It is.
and understanding how our choices impact its electrical system is crucial for maintaining heart health.
Well said. And while we've delved deep into the potential risks and disruptions,
Yeah,
it's equally important to remember that the heart is incredibly resilient and adaptable.
that's reassuring to hear. So, despite the potential pitfalls,
Right.
the heart is ultimately a pretty tough organ.
Absolutely. It's designed to beat continuously for a lifetime.
Wow.
With proper care and attention, we can help it stay strong and healthy.
Speaking of proper care, are there any specific things people can do to protect their heart's electrical system besides, not going overboard with alcohol or caffeine?
That's an excellent question.
Yeah.
And it leads us into the realm of lifestyle choices that can promote heart health, not just protect it from harm.
Okay, so we're talking about proactive steps to keep the heart's electrical system humming along smoothly.
Exactly.
Tell me more.
Well, maintaining a healthy weight, engaging in regular physical activity,
Uh-huh.
and eating a balanced diet are all essential for overall heart health,
Yeah.
including its electrical system.
So the same advice we hear for general health also applies to keeping the heart's electrical system in tip-top shape.
Exactly.
Yeah.
These lifestyle choices help regulate blood pressure,
Okay.
cholesterol levels, and blood sugar,
Mm-hmm.
all of which indirectly impact the heart's electrical stability.
It's all connected, isn't it? From those tiny ion batteries in each heart cell
It is.
to the lifestyle choices we make every day.
Right.
It all contributes to the health and well-being of this incredible organ.
Precisely. And that's what makes understanding the heart,
Yeah.
both its electrical and mechanical aspects,
Right.
so fascinating and empowering.
This deep dive has been an absolute eye-opener.
It has.
I feel like I've gained a whole new level of respect for the heart and a deeper understanding of the intricate dance of electrical signals that keep it beating.
Yeah.
But before we wrap up,
Hi.
I have one final question that's been nagging at me.
I'm all ears.
We've talked about the heart's electrical system as being independent of the brain,
Right.
but I've also heard about people having heart transplants
Yeah.
where a new heart is literally placed into their body.
Right.
How does that work?
It's amazing.
Does the transplanted heart somehow reconnect to the recipient's nervous system
That's a great question.
and start beating on its own? Or is there some kind of external pacemaker involved?
That's a fantastic question. And it touches on one of the most remarkable aspects of heart transplantation,
Okay.
the heart's ability to function autonomously even when separated from its original nervous system connections.
So you're saying a transplanted heart doesn't need to be rewired to the recipient's nervous system.
Right.
It can just start beating on its own.
Precisely. While the heart is influenced by the nervous system,
Right.
as we've discussed, its intrinsic electrical system,
Yeah.
with the SA node as its pacemaker, allows it to beat independently.
That's mind-blowing. So the transplanted heart essentially brings its own electrical system with it. Wow.
And while the new heart might not respond to the recipient's nervous system in the same way as their original heart,
Okay.
it's still capable of generating its own rhythm and maintaining blood flow.
Wow, that's a testament to the heart's incredible resilience and adaptability. It's truly an amazing organ.
It is indeed.
Yeah.
And it's a reminder that even in the face of seemingly insurmountable challenges,
Yeah.
the human body and the heart in particular
Right.
possesses remarkable abilities to heal and adapt.
This deep dive has been an incredible journey. I feel like I've learned so much about the heart, from its tiny ion batteries to its remarkable ability to function independently even after transplantation.
It's been my pleasure to share this journey with you.
But I'm sensing there's still more to explore. We've covered a lot of ground, but I feel like we've only just scratched the surface of this fascinating organ. What other mysteries of the heart are waiting to be uncovered?
Well, we could delve deeper into the world of congenital heart defects,
Okay.
where the heart's electrical system can be affected from birth. Or we can explore the cutting-edge research on regenerative medicine and the potential to one day grow new heart tissue from a patient's own cells.
Wow.
eliminating the need for transplantation altogether.
Now, those are deep dives I'd love to take. But I think we'll have to save those for another time. My brain is officially full for today.
I understand. It's important to digest this information and let it sink in.
Well, this has been an absolutely electrifying deep dive into the heart's electrical system.
It has been.
I feel like I've gone from ECG novice to, well, maybe not an expert,
Mhm.
but definitely more informed and definitely more in awe of this incredible organ.
That's what these deep dives are all about, fostering curiosity and deepening our understanding of the world around us
Yeah.
and within us.
And speaking of understanding,
Yes.
I'm left with one final thought.
Okay.
We've talked about the heart's electrical system in isolation,
Right.
but I'm curious about how it interacts with the brain. We've touched on the nervous system's influence on the heart, but what about the heart's influence on the brain? Is there a two-way street here? Can the heart actually send signals back to the brain that affect our emotions, our thoughts,
Interesting.
even our overall well-being?
That's a question that's been pondered by philosophers and scientists for centuries.
I bet.
And while we've traditionally viewed the heart as simply a pump,
Right.
recent research suggests that it might play a much more profound role in our mental and emotional lives.
Okay, now you've really piqued my curiosity. What kind of research are we talking about? And what are the implications of this heart-brain connection?
Well, there's a growing body of evidence
Okay.
suggesting that the heart possesses its own complex neural network,
Really?
a heart brain, if you will,
Ah,
that communicates with the brain in the head via the vagus nerve,
okay.
a major pathway for information flow between the body and the brain.
So the heart is not just passively receiving signals from the brain,
Right.
it's actively sending its own messages back.
Exactly.
Yeah.
And these messages seem to influence a wide range of functions,
Wow.
from regulating heart rate
Mm.
and blood pressure to modulating emotional responses and even cognitive processes like attention and decision-making.
Wow, that's incredible. So the heart is not just a pump, it's a sensory organ,
Right.
a communication center,
Uh-huh.
and perhaps even a contributor to our conscious experience.
It's a fascinating, evolving area of research.
Yeah.
And while we're still unraveling the complexities of this heart-brain connection,
Right.
it challenges our traditional view of the heart
Yeah.
and raises profound questions about the nature of consciousness itself.
This is blowing my mind. I feel like we've opened a whole new can of worms here, and I'm itching to learn more.
Yeah.
But I know we need to wrap up this deep dive. I guess we'll have to save this heart-brain mystery for another exploration.
Indeed. But for now,
Okay.
let this newfound knowledge about the heart's electrical system
Yeah.
and its potential influence on our minds and emotions
Right.
guide your journey of discovery.
That's a great note to end on. Thanks for joining me on this electrifying adventure into the heart's inner workings.
It's been my pleasure.
Wow, wow. I feel like we've journeyed to the center of the heart and back. You know?
It has been quite a journey.
Yeah, we've explored its intricate electrical system, uncovered the secrets behind those ECG squiggles,
Right.
and even touched on the mind-blowing connection between the heart and the brain.
It has been quite the adventure, hasn't it?
Yeah.
From those tiny ion batteries powering each heartbeat to the heart's ability to function independently even after transplantation.
It really is.
It's amazing.
It really is a testament to the incredible complexity and resilience of this vital organ.
It is.
My brain is buzzing with new insights, but before we sign off, I think a recap is in order, you know?
Yeah, for sure.
We've covered so much ground, it's easy to get lost in the electrical jumble.
A recap is a great idea.
Yeah.
Let's go for it.
Yeah.
Let's distill those key takeaways and leave our listener with a clear understanding of the heart's electrical symphony.
Okay, so starting with the basics, we learned that the heart has its own independent electrical system,
Yes.
with the SA node acting as the conductor,
Right.
setting the pace for the entire orchestra.
That's right. The SA node initiates the electrical impulse that spreads throughout the heart,
Yeah.
triggering the heart muscle to contract and pump blood.
And we discovered that this electrical impulse isn't just flowing through wire.
Right.
It's generated by the movement of ions.
Yes.
Like tiny charged particles across the cell membranes of heart muscle cells. It's like each cell has its own miniature battery,
It is.
creating the electrical potential that drives the heartbeat.
Precisely. And those ion movements
Yeah.
are what create the characteristic waves we see on an ECG,
Hmm.
the P wave, QRS complex, and T wave.
Yeah.
These waves represent the depolarization and repolarization of the heart muscle cells,
Right?
the electrical dance of contraction and relaxation that keeps blood flowing throughout the body.
Right, and we learned that even slight deviations in the shape, size, or timing of these waves
Yes.
can be red flags, signaling potential problems with the heart's rhythm,
Right.
like tachycardia,
Yes.
bradycardia,
Ah,
or even the more chaotic and life-threatening ventricular fibrillation.
exactly. Understanding these patterns and recognizing abnormalities is what allows healthcare professionals to diagnose and treat a wide range of heart conditions using ECGs as their guide.
We also delved into the concept of contractility,
Yes.
the heart muscle's ability to contract forcefully,
Love.
which goes beyond just the electrical signal. It's like the difference between tapping your finger and making a
Yeah,
fist.
good analogy.
Both involving muscle contraction, but with varying levels of force and intensity.
And we discovered that contractility is influenced by a complex interplay of factors,
Right.
including the availability of calcium ions, the stretching of the heart muscle fibers, and the influence of hormones like adrenaline.
It's amazing.
It's a dynamic process,
Yeah.
constantly adjusting to meet the body's ever-changing demands.
We even ventured into the fascinating realm of the heart-brain connection, exploring the emerging research that suggests the heart might be more than just a pump. It might actually communicate with the brain,
Exactly.
influencing our emotions, thoughts, and overall well-being.
It's a paradigm shift in our understanding of the heart,
Yeah.
challenging the traditional view and opening up a whole new avenue of exploration into the interconnectedness of our physical and mental states.
This deep dive has been an incredible journey.
It has.
I feel like I've gained a whole new level of respect for the heart, not just as a vital organ, but as a complex and fascinating system that plays a role in our overall health and well-being.
It's been a pleasure sharing this journey with you
Absolutely.
and with our listener.
And to our listener, thank you for joining us on this electrifying exploration of the heart's electrical system. We hope you've gained valuable insights and a newfound appreciation for this incredible organ that beats within us all.
Keep exploring, keep learning, and remember, knowledge is power,
Absolutely.
especially when it comes to understanding something as vital as your heart.
We'll see you next time on The Deep Dive,
See you then.
where we'll continue to explore the fascinating world of knowledge, one personalized deep dive at a time.